So hello everybody, welcome back to the platform of Unacademy. And since we have now started with the NEET PG 2022 preparation, so we are now going to start with important units in pediatrics, and we'll cover very fastly all the important topics that need to be understood for targeting your next upcoming exams. So before we start, just a word about the Unacademy and the subscriptions that we have so that all of you are well versed with it and you take the best possible subscription and you prepare really well for your exam. So again, to all of those who are listening to the class and all of those who would listen to the recorded version of the class, because we have this facility with Unacademy, so I would like to request all of you to please come and subscribe. So as we have seen that the NEET PG 2021 exam had so many questions which were taken up during the last minute revision sessions that we guys had from different educators on the Unacademy team. It has been very useful as reported by most of the candidates. Even if you go through the pediatric questions, the discussion of which I'll be taking on Wednesday, that is 15th of September, at 5 p.m. on the Unacademy app in the form of special class. So you guys can come and join this recall session discussion where I'll be discussing approximately 12 to 14 questions which has been asked straight from pediatrics or as an integrated question related to some radiology image or some hemat onco setting or some pathology slide. So integrated and all the isolated pediatric questions both would be taken up for the discussion on 15th of September at 5 p.m. That is on Wednesday. So for those who have still not subscribed, this is the best time for you guys to subscribe to the classes so that you can begin afresh and you can prepare with best possible extent for your upcoming exam. So we have a lot of subscriptions running right now, and to offer you, we have the best simple subscription that all of you at least should be a part of according to me, which is the plus subscription. So if you take a plus subscription, you have a lot of benefits of performing very nicely in your exam. So जिन लोगों ने सब्सक्राइब नहीं किया है, please come and subscribe, because if you take a subscription, you become a dedicated student of our team, and all the educators are going to help you prepare very nicely for the upcoming NEET PG exam. Okay, so it is very useful because you get so many benefits under the subscription, like you get access to live and recorded classes, you get to learn from top educators, you can compete in the live tests and quizzes, you can study on the device of your choice. So this is a very simple, very basic, and the best kind of facility that I find from an academy. It saves so much of time and effort. ठीक है, आपके कॉम्पिटिटर्स से ही आपको compete करना है एग्जाम में. So if you save your time and you're able to buy time from your own schedule, you're able to understand that saving time is a technique which toppers do inherit very early in their course. So you'll also be able to understand this thing and you can study in the comfort of your study room, and you just have to log in, you have to attend the class, make your notes and understand the topic. That is it. So if you stay synchronized with the educators, if you keep attending the classes regularly, if you're a subscriber, you don't need to do anything else. We are there to compile everything for you. We are there to help you prepare for the exam, to help you attend the quizzes, to help you improve your rank till the time you attain your dream rank and the dream performance before stepping in the exam hall. You also get the access to 25,000 plus questions. So best part is in questions के साथ explanation attached है. So if you find the question and you read the explanation simultaneously, इससे बहुत benefit होता है, because upcoming exam में क्या question आएगा, that revolves around the questions which have been asked in the previous exams. So इस साल जो भी questions आए हैं आपके, like from pediatrics you had question on iron deficiency anemia, you had questions on general pediatrics, जो मैं हर session में बोलती थी अगर revise करना है तो please general pediatrics पढ़ के जाओ. Last minute revision of general pediatrics is very important. You had question on rickets, you had question on scurvy, you had question on anthropometry, you had question on growth charts, and luckily all of those were revised very beautifully during the last few sessions that I had taken. The MCQ marathon, if you focus and had attended, you could find direct questions from that also, which were directly or indirectly asked in your NEET PG 2021. So these questions have been framed with a lot of sense inside it, and along with that you also find the attached explanation, so you can easily target the next upcoming question in the exam. Also, for those who are taking 12 months and above subscription, which is a very decent time to prepare for your exam, you also get hold of a printed set of notes. So plus subscription is the most basic subscription that we have to offer you, and I hope that all of you, those who are preparing seriously, would start to subscribe very soon. Then we also have the iconic subscription. Now those who are totally dependent on a very competitive preparation, we have this combo subscription to offer to you. So under this combo subscription, you get benefits of both, that is Unacademy and Prep Ladder. So it is very useful because once you test yourself from one platform, you always feel like competing with the other competitors, and you feel like testing yourself with another platform just out of curiosity that whether you're able to solve the MCQs from there or not, what is your performance with the competitors who are over there. So these kind of feelings and mixture of emotions keep coming when the exam is nearing by. So from the initial stages, if you get prepared, like you're doing theory and the classes from an academy team, you're studying our material, you're trying to attend all the classes under the plus subscription, which is a part of this iconic, and then you test yourself with the question banks, with the rapid revision courses, and all the important quizzes that they take from the prep ladder thing. So that gives you a lot of confidence from inside that your concepts are clear. So this is a very important thing. अगर आपके concepts clear होते हैं, आप question कहीं से भी आप solve कर सकते हो. So you can do that before going to the examination hall if you take the iconic subscription. So anybody who is planning to have a very serious preparation for the upcoming exam and you're planning to take any subscription, please go for iconic. So you will get benefits of plus. That means आपको live class मिलेगा, recorded classes मिलेंगे, you'll get the question bank, you will also get all the competitive live tests and quizzes, and you would also get the printed and digital notes. From Prep Ladder, you would get the integrated essentials, the video lectures, the question bank, rapid revision courses, and the dream notes as well. So we have a lot of important batches which are starting and have already in the course of getting started now. So target next 2022 batch, obviously the best important exam that we have to target, and all the educators are putting in their best efforts to help you get prepared for the upcoming exam. So you can take this fresh subscription which is starting from 15th of September, so that now you can again start preparing from the step 1. So जैसे जैसे आपके educators आपकी classes लेते हैं, जैसे जैसे आप revise करते हो, टेस्ट एंड क्विजेस में अटेंड करना शुरू करते हो, सी योर रैंक वेयर यू आर स्टैंडिंग at this point of time, and the improvement in your rank once you start giving all these live tests. So that growth which is going to happen in your preparation would be very nice if you start very early. So 15th September is the date. Please take the subscriptions and please start enrolling. Whenever you go to subscribe for your financial pocket friendly thing, also we have got this code which you can use so that you get extra 10% discount on your package. So Kavita S10 is the code that you can use to unlock additional 10% discount, so that you can easily take the package and it is not very financially difficult for you. So please come and enroll, because we are taking plus classes with a lot of dedication. We have put in a lot of special units and important topics into discussion this month, because this is the most crucial month. If you start with a good flow right now, you will remain in that competitive flow throughout your preparation. So from pediatrics, I would be taking cardiology and I would be taking respiratory unit this month. So those who are interested to learn these units, please come and subscribe for the plus hours, so that you get a part of this preparation and the plus hours, and you finish off these units simultaneously in the live classes. We also have the Focus FMG batch for FMG 2021 preparation. So it's a 3 months duration preparation, and you get hold of everything, including your notes, the grand test, the integrated approaches, the PDF is also available, and also the practice questions that would be there. Then we have a clinical examination and procedures batch, again starting on 15th of September. So this is going to help you to clear your approach towards the clinical part. So it is exclusively for the final year students who have to take up their prof exam. So joining an academy gives you a lot of benefit. You also have the choices of preparing for your MBBS profs, and simultaneously you can clear your concepts for the NEET PG. What best could be there? So please come and subscribe as soon as possible. So we have few special offers running for you. If you buy this 24 months package, you get additional 4 months subscription free. That means जो आपके 24 months का package है, in case you're not able to finish anything, you have not attended your live test, you could not read some of the topics, you get additional 4% free of cost online subscription. That means you can still access your course for additional 4 months. So this is also a limited period offer. So please, you can take this so that you can use your subscription for free duration of 4 months. And also we have 12+2 offer. So if you take it for 12 months subscription, you can get additional 2 months subscription free. Whenever you take any subscription, please use the code to avail extra 10% discount, that is Kavita S10. If you put down this code, you get additional 10% discount and you become a part of our team as well. Alright, so whenever you go to subscribe, please take the NEET PG section in the Unacademy app. You can find the courses as plus and iconic. Please choose the duration that you want to take. One golden point, always choose the duration that is available for you till the time of revision. Don't ever change your source of revision at the time in the last minute. So जब भी एग्जाम है आपका, जो भी एग्जाम आप टारगेट कर रहे हो, is it 2022 or is it after that? So whatever duration you have for your preparation, please take the subscription for that amount. ऐसा नहीं करना कि हाँ 12 months का ट्रायल ले लिया या 6 months का ट्रायल ले लिया, पढ़ लिया एक इंस्टीट्यूट से, and then you switch over to another set of notes. That's the most dreadful mistake one can do. So please stick to one thing, please stick to one set of notes जिसे upgrade करना आना चाहिए. Like I'm teaching you nephrology right now. If you sit down simultaneously and make your own notes, if you understand the topic, you listen to the classes carefully, you start to jot down the points in your notebook. And then if we have MCQ discussions, we have quizzes. If you come across any update on any of the social media, you can just add those points simultaneously. So towards the end, that base foundation that you have created during your initial 3 to 4 months of preparation, that gets piled up and it gets upgraded every time that you add anything. So last में आपको उसी से revise करना होता है. Please don't switch over your modes of preparation. So that is going to be very detrimental. So please take it for adequate duration. When you select your duration, just go to the payment option and put down this code. So if you put down this magical code, you again get 10% additional discount above the discount that Unacademy is offering you. So there's a surprise for all of you, those who are into the phase of preparing and those who are into the mindset of taking this subscription because the new classes have already started. So please come and subscribe as soon as possible. So for the first 500 students who are going to subscribe for this new offer right now for the iconic subscription, which is the best subscription that we have to offer you, for the first 500 students we have cut short the amount, which is very decent. So if you take a 12-month duration package, initially it was 45,000, we have put it down to 30,000 rupees. If you take 18 months, it has been cut short from 50 to 38,250. For 24 months, again, you can see the drastic change. That is from 55, it is now only 42,750. For 36 months also, from 65, it has become 51,750. And for 48 months, that is the most extensive package, which was costing 75, has now been cut short to 6750. So again, if you use my code, that is Kavita S10, above this amount you would get additional 10% discount, which is going to be the best pocket friendly thing that we can offer you guys. So जिन लोगों को iconic लेना है, that is the combo subscription which I was talking about, जहाँ पे आपको prep ladder भी मिलता है और Unacademy के benefits भी मिलते हैं. Please take it right away. If you come under this 500 candidates, the first order of 500 candidates, you will get this special discount as well. So जिन लोगों ने preparation शुरू कर दी है without wasting any time after NEET PG 2021, please extend your subscription. And those who are the freshers who are planning to take the subscription so that you can target the next year's exam, again, please come and subscribe as soon as possible. So this is a limited time offer. Don't waste any time and please come and subscribe. If you're following only the YT classes, which is free, and the special classes, which is again free of cost with the help of code that we provide. But if you're not a part of plus hours, you won't stay in that synchrony and you won't stay in that continuum of the preparation because the topics which are taught here could be random. So if you want to study the whole unit from one educator, you want to focus completely on a subject from one educator, so it's very important to come and subscribe. Plus you have the benefits of attending the class test, you have the benefits of attending the grand question series, you have the benefits of asking doubts and be a part of our team so that you get updated with all the important things related to next year's NEET PG exam. So this is the best thing for your preparation. So please come and subscribe, all of you. And we would meet on the plus hours as well so that I can also help you to finish your respiratory pediatrics well in time. So because I also specialize in pediatric pulmonology, so all of us can prepare very nicely the respiratory part of pediatrics in this month. All right, so beginning with the YT session, that is continuing on nephrotic syndrome. So I've already discussed the subscription part. So please come and subscribe and use my code whenever you have to subscribe. Okay, so yesterday we had a very basic discussion regarding the nephrotic syndrome, which is the most important and the cream topic in pediatric nephrology. So today we'll just briefly revise whatever we had studied yesterday. So best mode of studying is जो चीज आपने पढ़ ली है उस चीज को अपने दिमाग में फिट करने के लिए you just have to spend initial few minutes of your study of that subject into revision. जितना रिवाइज करोगे उतना ज्यादा आपके कंसेप्ट क्लियर होंगे, जितना कंसेप्ट क्लियर होगा उतनी आसानी से आप एमसीक्यू सॉल्व कर सकते हो. ओके, so just let's go through a fast revision of the small things that we had done yesterday, and then we'll head towards the clinical part, the pathophysiology and the management of nephrotic syndrome. Also, if you guys have any doubts during the understanding of the session, if you feel something needs to be repeated, you can be very free to put in the chat box. There's one doubt from a student who's asking when will be the next NEET PG 2022. Okay, so whatever rumors are there, I'm not very sure. There is no official notice about this, but being a part of the medical fraternity and being into one of the top running institutes in Delhi, so whatever is from my side that I can just give you as a piece of information is that the next 2022 exam is not going to be that late. It is expected to happen in the middle of the year. It won't happen in the month of January and February as it used to happen in January. So definitely, but not as late as September that has happened. So in the middle of the year, you can expect, because your juniors would be joining in after the counseling by the month of end of November or December, and the next year's NEET PG exam is most likely expected, as I have heard, between like March to May. So it won't get delayed beyond May. That is what is a verbal communication, but there's no official notice. There's no official verbal communication also from anybody, but this is what everybody in the medical fraternity is expecting. So please boost up your preparation. Maybe you are the target now because you haven't got enough time to prepare. The exam has just got over, and once the exam has got over, all of you should get up for the next year's exam. Don't just keep waiting and lazing around ki what would be your rank or how would you do. If you feel that you need to give a serious attempt, don't waste your time. ठीक है, इस dilemma में कभी भी नहीं रहना कि हाँ क्या होगा मेरे साथ, उसके बाद में देखूंगा सोचूंगा. That is not going to work out. So all of those who feel from inside, everybody knows the signal that what you have done in the exam, there is no worries at all. It is just a phase of life. So even those who are freshers who are going to attempt this year's exam, I mean 2022 exam, and those who honestly feel that you need to take a serious attempt, so please start right away. All the batches are starting right now. Please come and subscribe. All the educators have started the fresh revision courses because now you have to start to prepare for 2022. So since I had taken general pediatrics in detail last month, so I have started from systemic part. So once we finish the systems, we would again go and revise the general pediatrics and neonatology and social pediatrics and pediatric psychiatry. ठीक है, सो जिन लोगों को सीरियसली प्रिपेयर करना है, स्टार्ट गेटिंग योर नोट्स मेड. इफ यू मेक इट ऑन योर ओन फ्रॉम द एजुकेटर्स हु आर टीचिंग यू, दैट इज द बेस्ट वे. अगर आपको नेफ्रोलॉजी पढ़ना है, प्लीज पिक अप योर नोटबुक्स एंड स्टार्ट जॉटिंग डाउन द पॉइंट्स दैट इज टेकन अप इन द क्लास. Above these points, you can keep adding whatever extra you feel that you're learning from social media or any class or any MCQ. If you made a mistake, you can highlight the topic where you went wrong. So these are the tricks which help you to update your preparation till the time you reach the final month of your revision. Okay. So if you're interested in doing nephrology simultaneously, I would request all of you to get hold of a notebook and a pen and to start sitting and putting down the points in your notebook. So if you make it on your own, you will be very sure about each and every point that we would be discussing. Alright, so let's start with the session. So regarding nephrotic syndrome, I had told you very basic points in the last class, that it is a very common disease that is present in pediatrics. Don't think it is rare. It is very well present in Indian setup. So you can be asked a simple number based question about the incidence. So the incidence is around 100 per million. Incidence is around 100 per million children in India. Okay. Now the most important part of whole topic that we are going to read is the definition or the diagnosis of nephrotic syndrome. So what are the important points that you have to remember? What is nephrotic syndrome? ठीक है, कब कहोगे किसी बच्चे को nephrotic syndrome है? ठीक है, so when you have to label a person or a baby or a child because we are doing pediatrics as nephrotic syndrome, so please mark the words. Can you see first thing, it is or over here. ठीक है, इसका मतलब है प्रोटीनूरिया होना तो कंफर्म है. इफ यू डोंट हैव एविडेंस ऑफ प्रोटीनूरिया, यू कैन नॉट लेबल एज नेफ्रोटिक. ठीक है, नेफ्रोटिक पे क्वेश्चन भी आया था 2021 में. So I'm not starting with this topic knowingly that you feel that it is from the 2 units or topics that we keep teaching you frequently. It is just that we guys educators are aware, mostly aware, and we can predict like what can be asked, what is more important, what you should not absolutely miss, what you should study extra to get a little different rank, I mean a higher level rank. So हर चीज का एक आइडिया होना चाहिए. नेफ्रोटिक पे बहुत सिंपल सा क्वेश्चन था. They had only mentioned that a child had presented with generalized edema. So can you see the word anasarca is given in the notes? So these are already prepared. This is not because it was asked in NEET PG 2021. Generalized anasarca was present, and the urine had proteins and had fat droplets also. That was the rough estimate that I can give you of the question. We'll have a generalized and a detailed discussion on Wednesday where I'll exactly frame the question in the words that was asked. So वैसे question में अगर आपके options थे, one was about urinary infection, one option was related to nephritic syndrome, one option had good Pasteur's disease, and the fourth option was nephrotic syndrome. So it is classical that whenever you find proteinuria, it is nephrotic. If it is generalized anasarca, that means there is generalized body swelling, it is nephrotic. If the urine is containing of fat droplets, it is nephrotic. अगर infection answer होता उस question का जो NEET PG में आया है, then you would have found TLCs in the urine or maybe any kind of pus cells or epithelial cells, so that is out. Good Pasteur's में again it is bleeding because it is an autoimmune disorder that hampers your renal and your pulmonary part, so that option also goes out. Nephritic is classically something that presents with high BP and hematuria, so again that goes out. So it was a very very simple and a very beautiful question, very basic question which was asked in your NEET PG 2021. So that is how, if you understand the important topics and you make notes of it on your own and you read from the same set of notes again and again, आपके concepts इतने clear हो जाएंगे that you don't even need more than 5 seconds to solve the questions in the exam. So if you were very well versed with this page, if anybody has read it, I don't think you could have taken more than 3 seconds to solve that question, right? Yes, the same question was there in NEET PG 2021. Somebody is commenting, Keshav. So that's right. That is what I'm telling you, that it is not that we teach, I'm knowingly teaching you this nephrotic syndrome because the question had come. I had already started taking the class as soon as the NEET PG had ended. I'm just giving you an example, not only about myself, about all the educators and the whole Unacademy team, that we teach you the things which we expect will come in the exam, because we as educators, we can predict what the examiner would think at your level. NEET PG exam सिर्फ एक screening exam है. Screening as in they just want to screen and see what is your basic level. You don't need to know the recent updates of nephrotic, which is the latest drug which is used in nephrotic syndrome, or any kind of difficult question like कौन से vaccine contraindicated है. So these are post MD levels, मतलब जिन्हें pediatrician बनना है उनके लिए चीजें important होती है. But आपके level पे they had asked such a beautiful question. A simple 9 or 10-year-old child had presented with generalized swelling of the body. Generalized swelling का मतलब क्या है? उसको hypoalbuminemia है, ठीक है? So hypoalbuminemia is a classical thing. You can see in the first slide itself. Everything is written over here. Hypoalbuminemia था, urine में fat droplets थे, मतलब lipid is getting excreted. Hyperlipidemia is already there, and the baby child also had protein excretion in the urine. There was no blood cells, there was no hematuria evidence given in the question, and the options were so clearly written, very very clearly, and a very simple, beautiful question. I just loved that question. It was urinary tract infection or something related to urine infection. उसमें आराम से आपको TLCs और pus cells दिख जाते. That was not in the question. Good Pasteur's is classical for hematuria. मतलब उसमें pulmonary और renal hemorrhage होता है. Hematuria था नहीं question में. Nephritic syndrome is classically having high BP and having hematuria, again red blood cells in the urine. वो भी question में नहीं था, और आंसर आपका सिर्फ fourth option था, nephrotic syndrome. And if you see simply, if you know the definition also, आपको सिर्फ 2 या 3 सेकंड लगते उस क्वेश्चन का आंसर करने में. That is why I'm requesting you guys, those who haven't subscribed, please come and subscribe, because YT and special classes are taken in a random sequence. You might not feel very very comfortable like attending nephrology once and attending something else, so that becomes very difficult to have a complete set of notes. अगर आप प्लस सब्सक्राइबर्स हैं, आपको नोट्स भी मिलते हैं, आपको MCQs भी मिलते हैं, आपको एक डेडिकेटेड टीचिंग मिलती है, and you become a part of our team, so we feel responsible towards you and we feel that yes, your whole unit should be completed very nicely. So if you want to see the way of teaching, you can go and listen to my cardiology lectures that I've taken on YT. Whatever I've taught over there, that is the basic content of cardiology. And honestly, there was again a question in NEET PG 2021, and I'll take the detailed discussion on Wednesday around 5 p.m. So you can come and use my code Kavita S10 to unlock. That is my code Kavita S10. You can use this code to unlock the special class on Wednesday at 5 p.m. and listen it free of cost, because this is a special class for all of you. And honestly, there were 2 questions in NEET PG 2021 exam. regarding your cardiology that I could remember three questions instead. So one was about fetal circulation. So first day itself, the first lecture that I've taken on cardiology had very well explained the fetal circulation and how umbilical vein and umbilical arteries act. So there was a question on the oxygenated blood getting returned to placenta, and the options were same. It was umbilical artery, umbilical vein, I think ductus, and everything was given. So I had just told you it is the reversal in the fetal circulation. So reversal में क्या होता है आपका, कहने का मतलब आर्टरी में डर्टी होता है और वेन में आपका ऑक्सीजनेटेड ब्लड होता है. This simple trick I had told you to remember in fetal circulation, that was the same question which was asked. Then you had a question on image based question regarding snowman appearance of the heart, right? ह्यूमन अपीयरेंस के इमेज मैंने इतने बार दिखाया है, कार्डियोलॉजी इमेज बेस्ड क्विज में डिस्कस किया है, एमसीक्यू मैराथन्स में डिस्कस किया, मे बी 3-4 टाइम्स आई हैड शोन यू दैट स्नोमैन इमेज, और ये भी बताया था स्नोमैन इस पे सुपर इम्पोज कैसे होता है क्योंकि हार्ट का शेप ऐसा हो जाता है. ठीक है, सो दिस दे हैव सुपर इम्पोज्ड एज अ स्नोमैन. सो दैट वाज वेरी सिंपल. In fact, I told you snowman will save you so many times in pediatrics because I have used the snowman trick in developmental milestones, in general pediatrics, and cardiology. So these were the jokes that we crack so that you guys are able to remember and recall easily whatever is asked in the exam. Then there was a question where there was inferior notching of the rib, and the same question was asked so many times in the MCQ marathons that I had conducted, and I hope that those who had attended could mark the answer right in 3 seconds. So inferior notching of the rib, coarctation of aorta में होती है. So and there was clear cut indication that the patient had absence of pulse was also given. So साफ साफ मैंने कितने बार आपको समझाया था in the classes also, if there is an obstruction to the blood flow, the preductal part will have increased BP, increased peripheral pulses, increased saturation, and the postductal part would not have the same. So absence of pulses कहने का मतलब है there is some obstruction to the blood. And if you go and listen to the class also on obstructive cardiac lesions, which was I think the second lecture I took in cardiology, the first thing I mentioned on classification of obstructive lesion was about coarctation of aorta. So that becomes वेरी इजी टू सॉल्व इफ यू नो. सुपीरियर रिब नॉचिंग के बारे में भी मैंने बताया था कि अगर इंफीरियर बार बार पूछ रहे हैं तो नेक्स्ट टाइम यू कैन बी आस्क्ड अबाउट सुपीरियर. सो दोज वर टारगेटिंग नेक्स्ट ईयर्स एग्जाम, प्लीज बी अवेयर ऑफ द कॉजेज ऑफ सुपीरियर रिब नॉचिंग, आउट ऑफ विच मार्फन सिंड्रोम इज वन वेरी वेरी इंपॉर्टेंट थिंग. So these things will be discussed in detail if you attend the subscribed classes, because we feel a dedication towards you and we also try to offer the best that we can from our side. And also in cardiology there was another question. Snowman was there. There was a question on fetal circulation. There was a question on inferior nib notching. There were 3 or 4 questions. So detailed discussion I'll do it on Wednesday, where we will see what mistakes could have been committed, what the examiner was expecting. And there are 2 questions on hemat, which is very very confusing till date. Many students expect the answer should be this, but that is not the answer. So I'll give a detailed analysis on Wednesday. All of you, those who would listen to the live class और जो recorded सुनोगे, please come and join on Wednesday at 5 p.m. You can use my code Kavita S10 to unlock the class, and I would discuss the straight away question from pediatrics, which were many questions had come, around 12 questions had come from pediatrics, and 2-3 questions were the integrated questions which were linked to maybe hemat onco classes or which were linked to pathology slides, or the age was like 2021. So I'll discuss that as well. Okay, so all of you can come and attend it. Yes, we'll discuss all of that. There was a question on ABG analysis also. The answer I think was respiratory alkalosis. I haven't got the recall of exact figures. So whatever figures I had got from the learners, the answer comes as respiratory alkalosis. So you guys can also help me to recall all of these numbers and everything in the class. ABG pe maine 3 times I have taken class. The initial class which was there, then I had taken a marathon revision class, then I had taken a special class again on ABG. I had made you solve ABG right away with the figures, and in the live chat I could expect that many students had answered them right. So I was very happy that ABG analysis is clear from my side. So I think many things were discussed in the last 15-20 days of the revision marathon. So I feel very happy that I could deliver whatever best I could, because I'm a new educator on the Unacademy team. It's just been 1 or 2 months since I've started teaching you guys, but still I could cover whatever I could in that 1 or 2 months. So from general, I think whatever I had taught, everything was answerable. The growth chart, the SAM nutrition, SAM question was there. Then the height analysis question, the short stature question, everything was discussed. So I feel very proud also and very happy also that I could deliver whatever I could the best in my last few 15 days of revision, and many students have marked it right also, so that makes me feel all the more proud from the Unacademy followers. And also there were certain difficult questions, the answers for which is still not clear. I will also try to explain you as much as I can. Then let's see what comes as the final answer. So you guys can also help me to recall the questions on Wednesday. So as of now, let's start learning about nephrotic. So those who are again targeting the next year's exam, please see that it is very important what we deliver to you. We deliver it in the utmost refined form. So please try to make notes out of it. Please try to remember the things that we teach you. Don't go here and there and follow n number of things like different textbooks, different social medias. Just stick to one thing. If you trust your educator, you feel that the questions that were asked were already discussed, the questions which were asked has been taught in the classes, that is the best proof that I can tell you from us and for you also. So please stick to one source. जितने बार रिवाइज करोगे आपके रिविजन साइकिल्स इंपॉर्टेंट होते हैं. ये इंपॉर्टेंट नहीं होता कि आपने कहाँ से तैयारी की है, किस कोचिंग इंस्टीट्यूट से पढ़ाई की है, किस एडुकेटर के नोट्स फॉलो किए हैं. ऑल दैट मैटर्स इज व्हाट यू हैव स्टडीड from your own hands and with the use of your own brains. ठीक है, जो नोट्स आपने बनाए हैं उसको जितने बार रिवाइज करोगे उतना बेनिफिट होगा. So if you feel any one of you those who is listening to the class, if you feel that the way of teaching of this educator is good, not only about myself, anybody, please get hold of a notebook and a paper and a pen, sit down and jot down the important points in your own handwriting. Keep highlighting the things that you find difficult. Keep highlighting the things that you think that you have to revise in the end minute. So you have to cut short the syllabus every month of your preparation. Last में वो syllabus इतना से इतना हो जाना चाहिए, so that you just know what I need to focus on before stepping in the examination hall. Okay, all right. So let's start with the topic. So nephrotic का incidence हमारी country में it's approximately 100 per million in India. ठीक है, it is a common disease. It is very well present in India, and the incidence is also very high. Now coming to the definition, and also a very good example that this question was there in the NEET PG 2021. Please mark the words. If you don't have proteinuria, that means or. पहला criteria तो होना ही होना चाहिए. That means proteinuria has to be there. Now NEET PG is one exam which is very fond of playing with the numbers. So numbers देना और units change करना और confuse करना is one thing which people find it very difficult. So whenever you come across numbers and figures, please be very sure of the number that is being used, and please be very sure of the unit which is given. If you don't see that very carefully, many a times you would find that gram को milligram कर दिया, hours को minutes कर दिया. So that thing should be crystal clear. So proteinuria होना कितना चाहिए, तीन चीजें याद रखनी है. If it is more than 3.5 grams per 24 hours, that is a nephrotic range proteinuria. Maybe you don't get a question straight away on nephrotic. You might be simply asked what is the cutoff for nephrotic range proteinuria. Answer is 3.5 grams per 24 hours. Or if it is 40 milligrams per meter square per hour, और 1 ग्राम पर मीटर स्क्वायर पर डे. ठीक है, ये तीनों फिगर्स आपको अच्छे से याद होने चाहिए. 3.5 ग्राम पर 24 आवर्स, 40 milligram per meter square per hour, और 1 gram per meter square per day. So this has to be there. There is no option of skipping out proteinuria. Proteinuria कैसे टेस्ट करते हैं? We have a very simple dipstick test that we do bedside. So we have this facility. You can easily do the dipstick test. So proteinuria has to be present. अगर ये cut off cross हो रहा है, apart from this, if you find any supportive features like spot UP-UC ratio is more than 2 or your dipstick is more than equal to 3+, इसका मतलब same है. इतना protein range जो आपका है nephrotic range of protein loss if it is happening in the body, your UP-UC ratio becomes 2 and your dipstick becomes more than equal to 3+. या तो 3+ हो सकता है, 4+ हो सकता है. So अगर 3 तक भी आपका nephrotic range proteinuria है और dipstick 3+ तक आ रहा है, you can suspect a nephrotic syndrome. Apart from this, और supportive चीजें क्या होती है? You would have hypoalbuminemia. Albumin कितना कम हो जाता है? Cut off is 2.5. 2.5 grams per deciliter is the cutoff for hypoalbuminemia. So your albumin is going to become less. NSR का क्या है? There is generalized body swelling. So very important, clinically कैसे देखते हो कि आपको जो NSR का मिल रहा है patient में, that is of renal origin. So clinically, whenever you see that the puffiness or the NSR का or the swelling is starting from the periorbital area, that is your face. ठीक है, अगर बच्चे का फेस का स्वेलिंग डॉक्यूमेंट कर रहे हैं पेरेंट्स, दैट मीन्स इफ द चाइल्ड इज हैविंग पेरी ऑर्बिटल स्वेलिंग, उसकी आईज की चारों तरफ की एडिमा बहुत ज्यादा इंक्रीज हो जाती है, Following the face, it goes on the extremities. Following the extremities, it goes on the central abdomen. Following the central abdomen, it also involves the genitalia of the baby. This sequence is very very classical for renal onset of anasarca. ठीक है? अगर ये anasarca और किस वजह से हो सकता है in the body, can anybody put in the chat box? What are the other causes of generalized anasarca in pediatrics? What else could lead to a similar presentation? Please put in the chat box. Why have I taught you this sequence of involvement in the body? So that in clinical questions, now all the exams are not simple one-liners. You might be targeting other exams as well. Even in your NEET PG exam, you might get a clinical question. This time you were expecting that mostly all the questions would be long, but it was not so, because NEET PG has a fixed set of pattern that they ask you straight away lines given in your standard textbooks. So, but clinical questions are also there. The questions were framed very beautifully. So this concept I'm telling you because if you have a clinical question, that means you might be asked ki, the child presented with facial swelling, had periorbital puffiness, his protein level was this much. So these things can be asked in a clinical format. But क्योंकि ये Indian exam है, India का exam है, India में पेशेंट्स और पेरेंट्स इतने अवेयर होते नहीं है, दे डोंट स्पीक टू मच कि दे विल डिस्क्राइब द होल क्लिनिकल सिनेरियो लाइक योर यूएसएमएलई एग्जाम्स एंड योर फॉरेन एंट्रेंस एग्जाम्स वेयर दे हैव सच बिग क्वेश्चंस, बिकॉज वो डिस्क्राइब ही इतना करते हैं. दे विल ऑल्सो टेल यू कि मैंने डिपस्टिक किया था और 3+ आ रहा था और 3 दिन तक लगातार 3+ आया, एंड दे विल टेल यू एवरीथिंग एंड एनीथिंग. So it's not a complete kind USMLE kind of an approach, but you can get simple hints in your question, which is something that the parents and the children come and tell you. So at max, the parent can tell that yes, the child had periorbital puffiness, the child gradually started to increase in abdominal distension, the child started to have swelling in the scrotum. So these simple things they can pinpoint and tell you. So Indian setup में clinical questions इतने अच्छे से expect करना is little difficult, but still you can get pointers like they had swelling on the face. So ये चीज इसलिए important है. Yes, that is right. Congestive cardiac failure. Tarek has answered that. That is absolutely right. So आपके cardiac failure का, आपके renal failure का, and also because of your metabolic problems. These three are the important things जिसमें आपकी swelling बहुत ही ज़्यादा pronounced होती है body में. So renal swelling always starts from the face. It will go and progress towards your extremities, abdomen, and the genitalia. And whenever you have swelling because of cardiac failure, you would get the swellings right on the extremities. So extremities say you will have abdominal distension because of congestion due to cardiac failure leading to hepatomegaly. So छोटे बच्चों में hepatomegaly is the most sensitive sign to detect your congestive cardiac failure, and also you would find that the abdomen has distended out. So extremities की swelling अगर पहले आ रही है and then the abdomen, that is your cardiac origin. Facial swelling followed by abdomen and followed by extremities and abdomen, that is your renal origin. If you get a complete anasarca because of metabolic problems like there's severe iron deficiency, anemia, or any kind of metabolic derangement, it will right away start from the abdomen. ठीक है? So ये clinical aspect भी बहुत important है. So anasarca would be present, and if you ask the history, the mother would typically say that it started from the eyes or the face. ठीक है? इसके अलावा fourth criteria or the fourth supporting thing is hyperlipidemia. So hyperlipidemia कहने का मतलब क्या है? The lipid levels would increase. Which is the most common lipid that we test in the blood? मोस्ट कॉमनली कौन से लिपिड का टेस्ट करते हैं? वी टेस्ट कोलेस्ट्रॉल लेवल्स. ठीक है. आई थिंक द क्वेश्चन ऑल्सो हैड द कट ऑफ फॉर कोलेस्ट्रॉल. इट वाज समथिंग मोर देन 200, like 240 was the approximate number that I got from the learners. So 240 was the question में दिया भी हुआ था शायद 240, and can you see the slide mentions cholesterol was more than 200 milligrams per deciliter. So ये ऐसा नहीं है कि मैंने जानबूझ के नेफ्रोटिक उठाया, ये ऐसा है कि आपको दिखाना चाह रही हूँ that yes, whatever we teach, if you do it sincerely, if you keep following us, if you study according to the educators, and whatever efforts we are putting in, it will definitely bring you success. ठीक है. So क्या पढ़ना है किस टॉपिक से, कोई भी नेल्सन उठा के रट्टा नहीं मार सकता. कोई भी टेक्स्ट बुक, be it any Indian origin textbook or your guide Bible for pediatrics, that is Nelson, you cannot sit and learn it from the book straight away. You should know कि पढ़ना क्या है, कितना पढ़ना है, कैसे पढ़ना है. इसलिए प्लस और आइकॉनिक इसलिए सब्सक्राइब करते हैं so that you get a direction to prepare. You can cannot sit with the standard textbooks of 19 subjects and mug it up for your NEET PG exam. Obviously, no. You have to use half of your time of preparation into the targeting MCQs. कि मैं solve कैसे करूँ question में, वो expect है, all true, all of the following are true except, which is the wrong statement, which is the true statement. इन टेक्निक्स को सॉल्व करना प्रैक्टिस करने में हाउ टू यू ओरिएंट योरसेल्फ, आधा टाइम तो उसमें चला जाता है और आधा टाइम जो रहता है उसमें आपको सारे सब्जेक्ट्स पढ़ने पड़ते हैं. वो कैसे पढ़ोगे? ऑब्वियसली इफ यू हैव अ रिफाइंड क्वालिटी नोट्स विथ यू. सो नोट्स बनाना बहुत इंपॉर्टेंट है. Either get the subscription and get the notes straight away and start reading it from there, or the best part that I personally feel and personally recommend is to sit down with a notebook and a simple pen and start making notes and jotting down the points. At the end of it, you can highlight it, color it, try to see what is difficult, try to see what is important, and that will bring you to cutting short your 19 subjects to this much. So this much is easily revised during the last month also. ठीक है. So hyperlipidemia कट ऑफ कितना है? 200. अगर ये स्लाइड भी पता था, आराम से वो क्वेश्चन 2 सेकेंड में आंसर हो जाता है. ठीक है. So yes, the answer, it was given more than 200. That is what I was told by the learners, that cholesterol level was given, anasarca was given, fat cells in the urine was given, and the age of the child was also given, which is classical, the pediatric age group. So you could suspect a nephrotic syndrome. So please be very sure about the definition. Now coming to the types of nephrotic syndrome. In pediatrics, we believe that nephrotic syndrome का most common cause क्या है? Most common cause is idiopathic. Don't mark anything else. So basically, your nephrotic syndrome is of two types. One is the primary type and the other is the secondary type. So renal damage, renal organ or renal system is a very sensitive system in our body. It can be damaged owing to any kind of infection. It can be damaged as a part of any complex syndrome which has occurred in the body. It can be damaged because of any genetic mutation, like you must have seen your Finnish type of nephrotic syndrome, your Danish Drash syndrome, Neil Patella syndrome. So there are so many things which can damage your kidney. So these are the things which have a secondary involvement of kidney. तो ये सारे causes आपके आ जाते हैं secondary part में. ठीक है. Yes, minimal change disease is the most common type. That is the most common type of idiopathic type. ठीक है. So ये सारे causes जिसकी वजह से आपका किडनी खराब हो रहा है, ये सब आ जाते हैं secondary causes में. You don't have to go for any option from these. Most common cause, yeah, I would say more than 90% of the cases of nephrotic that occurs is because of the primary cause. Nobody knows the cause. So it is idiopathic. Idiopathic में based on the findings that we see on histopath confirmation, we have classified it into these 5 types. ठीक है. Please mark the words that I am telling you. Most common cause is idiopathic. Don't mark any specific cause for nephrotic syndrome. Most common idiopathic होता है. Idiopathic में based on the involvement of your glomeruli and based on the changes that occur, we have classified idiopathic or the primary type into these 5 types. What are the names of the 5 types? Please be sure. First one is minimal change disease. If they ask you specifically about minimal change disease, yes, this is the most common type that you find in pediatric age group. ठीक है. Apart from this, the atypical types. Atypical कहने का मतलब which are less, which are rare, but they are present definitely, are the focal segmental glomerulosclerosis. You also have got mesangial proliferative, you have got membranous nephropathy, and you have got membranoproliferative glomerulonephritis. ठीक है. Take a minute to remember the names. Now, please don't confuse with 3 M's. You have mesangial proliferative, you have membranoproliferative, and you have membranous. Just remember the first words also. That would also help you to clear cut the things. Mesangial proliferative, membranoproliferative, and membranous nephropathy. ठीक है. ये 3 M से हो गए. Most common तो सबको याद ही होगा, minimal change disease, and you have one that is known as focal segmental glomerulosclerosis. ठीक है. Just take a minute to revise this. साथ साथ में जितना याद कर सकते हो, जितना समझ सकते हो, that is the best thing. Those who are listening live and those who would listen to the recorded version also, I guess that you can study simultaneously, because अब आप सबके पास बहुत टाइम है प्रिपेयर करने के लिए, बहुत ज़्यादा भी नहीं है, but definitely you are not into that stress period of last 1 month of preparation that you have to ratify everything. So please try to understand things as it is being taught and take a moment to revise things at the end of the class also. Okay. So these are the 5 types which have been classified under the idiopathic. Now, as I was telling you that there are many causes which can lead to nephrotic syndrome, and the are the causes which lead to secondary type. So secondary में कुछ भी हो सकता है. It can be because of genetic causes. जितने भी genetic causes हैं उनको हम congenital nephrotic syndrome कहते हैं. So if you get a question next time, maybe in the exam, that a baby, newborn baby, या less than 1 month aged baby is having a picture of nephrotic, will you get confused? Would you be amazed कि ऐसे कैसे हो सकता है? nephrotic तो school going बच्चों में होता है, बड़े बच्चों में होता है. Is it true? Absolutely no. You have something known as congenital nephrotic syndrome. ठीक है? These are right because of the genetic mutation, and you can have a very small baby like 1 or 2 months baby who presents with these features of nephrotic. They would have proteinuria, they would have generalized anasarca, they will also have lipid cells, they can present with high BP recordings as well. ठीक है? So genetic causes या congenital nephrotic syndrome exists. Please be aware of it. Don't think it happens only in 4 to 5, 6 years old children. So if you get a question next time on congenital nephrotic syndrome, please don't be amazed. It is there. And 2 things that you have to remember is NPHS1 gene and NPHS2 gene. ठीक है? NPHS1 and NPHS2. These are the 2 important genetic mutations that occur in your nephrotic syndrome. NPHS1 को हम कहते हैं finish type, and NPHS2 is your corticosteroid resistant nephrotic syndrome. It is caused because of your nephrin and the podosin proteins which are responsible for this kind of disease. But most commonly you would be asked about the name of the gene, so you should be aware that there is NPHS1 and there is NPHS2. ठीक है? अब क्योंकि NPHS1 और 2 पे बहुत बार क्वेश्चन आ चुका है, you need to upgrade yourself, so please remember these following 2 names that I have put over here. That is your diffuse mesangial sclerosis. So diffuse involvement किसमें मिलती है? PLCE1. ठीक है? PLCE1 that is responsible for your diffuse mesangial sclerosis, and corticosteroid resistant FSGS type is seen with the mutation of MYO1E. ठीक है? So just remember the name of these 2 genes because these can be a recent update questions. So हमें 2 तरीके से पढ़ाई करनी होती है. अगर हमने नई पढ़ाई शुरू करी है, means you're targeting the upcoming exam. One is the basic preparation which nobody can bunk or nobody can miss. Like nephrotic का definition क्या है, nephrotic की treatment क्या है, nephrotic के types क्या है. And one is little हटके कहने का मतलब थोड़ा सा upgrade करके, so that if you get an altered question or a recent update question, you don't miss it because you did not hear about it. So that is a very sad state, that if you did not hear about anything about that question, you have to leave it in the exam, right? You cannot go and increase your negative marks. So थोड़ा सा हटके पढ़ना, थोड़ा सा extra effort करना, that can fetch you a lot of marks extra in the exam. ठीक है? So because you guys are now a new set of learners who's targeting the next year's exam, so definitely you have time to put in little extra effort, little extra hard work for that dream rank that you want. So in every topic, whatever extra could be expected to be asked, or anything that is there which is a lot of potential to be asked, that would also be included in the slides. So please make a note of it. Okay? So diffuse mesangial sclerosis and corticosteroid resistant FSGS. Please remember these 2 genetic mutations that is responsible for it. Okay? Now, because autosomal recessive types have been asked most of the times, it is expected again that you can get autosomal dominant. So just remember autosomal dominant कौन सा है? All the FSGS types. जितने भी FSGS types है उनका inheritance autosomal dominant होता है. Okay? Yes, anybody who's having any doubts, you can put it in the chat box. You can keep asking your doubts. Whenever I'm able to read it out, I'll confirm whatever doubts that you have. And if I'm not sure, I won't answer anything. I will read about it and then tell you in the next session. Okay, you can ask any doubts that you have in the chat box. So autosomal dominant में you have FSGS type. Okay. Now apart from the primary causes, what is more important for your MCQ is secondary causes. Primary तो सबको पता है, वो 5 टाइप है जो हर साल एग्जाम में पूछे जाते हैं. So secondary causes क्या होते हैं nephrotic syndrome के? As I told you that secondary cause कहने का मतलब है as a reaction in the body when any infection, any disease, any underlying carcinoma, any toxicity of anything can lead to damage to your renal system. Okay, renal system is a very, very sensitive system, and if it gets damaged, the first thing that presents is anasarca. Okay, So this is going to happen if there are certain causes in our body which has led to the damage of renal system. So please remember about the causes. We have infectious cause, we have immunological causes, we have underlying carcinomas, and we have certain drugs which can lead to this kind of problem. Okay, so इन पे बहुत बार questions आ चुका है, आ भी सकता है, because it's very important. So you can be simply framed a question to give you as a hint that a patient was diagnosed with hepatitis B or C, or was diagnosed with HIV. These things are the reports. They give you CBC and everything. You might be asked about a clinical presentation, because when the patient had generalized anasarca, what could be the underlying cause? So hypoalbuminemia भी हो सकता है आंसर, उसका नेफ्रोटिक भी आंसर हो सकता है, because ultimately it is hypoalbuminemia which will lead to your generalized anasarca, and nephrotic syndrome का एक part होता है hypoalbuminemia. So okay, so there's a very sensitive question in the chat box from Privash. नीट में इस बार कुछ भी डीप नहीं आया, and I've been studying a lot these days. What should we do at this point when the questions are uncertain? Yes, I also felt a little bad about this, because definitely, as I told you in the last slide, that is what has affected you, that you have to study in two parts. First part is, as a fresh student, you have to finish the syllabus that is expected out of you. Once you're through that syllabus, जैसे अभी मैंने बताया नेफ्रोटिक सिंड्रोम का डेफिनेशन क्या है, नेफ्रोटिक के कॉजेज क्या है, नेफ्रोटिक की ट्रीटमेंट क्या है. Beyond that, there are certain questions which give you an extra edge over the other students. So whatever 14 questions that I had extracted out in pediatrics, also the integrated ones, there were around 14 questions. उसमें से सिर्फ 2 क्वेश्चन ऐसे थे which were little difficult to answer, या ऐसे कह सकते हैं जिन लोगों ने ज़्यादा मेहनत करी है, या जिन लोगों ने बहुत एक्स्ट्रा पढ़ाई करी है, जो थोड़े हाई लेवल की अंडरस्टैंडिंग के साथ जिन्होंने प्रिपेयर किया है, वो आंसर कर सकते थे. One was on iron deficiency anemia, and one was about vitamin B12 deficiency. जो मैक्सिमम लोगों ने B12 मार्क किया, उसका आंसर फॉलिक एसिड है. So we'll do a detailed discussion on Wednesday, and I'll explain from my side whatever best I could. You can also involve yourself in the discussion. तो अकॉर्डिंग टू मी द आंसर शुड बी फॉलिक एसिड, क्योंकि उन्होंने कंफ्यूज करने के लिए आपको दिया था वेजिटेरियन डाइट, बट वेजिटेरियन डाइट के आगे लो वेजिटेरियन डाइट भी लिखा था, जो बहुत लोग जल्दबाजी में मिस कर देते हैं. ठीक है, सो दीज थिंग्स मेक अ डिफरेंस. सो दोज वर प्रिपेयरिंग फ्रेश फॉर द एग्जाम, definitely this is a little sad part, that those who had taken so many months of exam कब होगा कब होगा कब होगा पता ही नहीं था, finally जब हुआ after so many months, or maybe any year long I could say, so it enrolls all the candidates with you, like those who have had a very high level of preparation and those who were at a very fresh level of preparation. So that time and effort that you have put, that gets compromised if you get a very basic question, like if they just ask you the definition part or something which everybody is aware of as a preparator, that they know that yes, nephrotic में तो ये होता है, so that becomes okay, that's very great that you marked folic acid as the answer. So that is because you had that level of preparation. Maybe you had read things in too much detail and you had reached that level. So don't be sad even if you have marked it right, all the answers, and others have also marked it right. Just be happy कि सबका selection हो जाएगा. So maybe your rank would be a little better. So you can take your dean branch because you have marked all the things right and you have prepared everything in too much detail. So don't be sad. सबका selection हो जाएगा, अच्छी बात है. This year is going to be a merry-go-round for everybody, because the questions were very basic and they were like totally friendly questions which have been taught I think by all the educators in all the subjects, I would say, क्योंकि मैंने जितने recall questions देखे, I can also solve questions on other topics because obviously I'm post MD. So it was very basic paper according to me. It was not very difficult or very जितने हम concept based MCQs आपको train कर रहे थे कि cherry red spot है, ये DD है, patient को hepatosplenomegaly था, ये था, वो था, इसका आंसर क्या होगा. So I had framed myself so many difficult questions which you guys had answered in the live sessions very beautifully. I was very proud that you could answer these type of questions also. But हाँ, paper बहुत basic था. That is my personal opinion that I would give. So ऐसे candidates जो बहुत well prepared होते हैं, उन्हें लगता है अरे चलो ठीक है, हो तो जाएगा. बट कोई बात नहीं, फील हैप्पी कि सबका सिलेक्शन हो जाएगा. जिन लोगों ने भी थोड़ा बहुत पढ़ाई करके एग्जाम दिया है अच्छे से, ऑल ऑफ देम वुड गेट अ गुड रैंक. जिन लोगों ने बहुत अच्छे से पेपर सॉल्व किया है, बट स्टिल यू सी द एग्जामिनर्स आर नॉट दैट रूड विथ यू. कुछ क्वेश्चंस होते हैं ऐसे जो हटके होते हैं, एक्स्ट्रा एज वाले क्वेश्चंस होते हैं, सो यू कैन टारगेट दोज क्वेश्चंस. सो दैट इज नॉट द प्रॉब्लम. ठीक है, सो यू कैन टारगेट दोज क्वेश्चंस अगर आप अच्छे से पढ़ोगे. अब जैसे इस स्लाइड को देख लो, मतलब एनी एग्जाम्पल यू कैन टेक. आई एम जस्ट टेलिंग यू अबाउट द जनरल परसेप्शन. सेकेंडरी के कॉजेस काफी लोगों को बस इन्फेक्शन पता होगा. ऑनेस्टली दोज वर लिस्निंग टू द क्लास ऑल्सो, हेपेटाइटिस, HIV, मलेरिया, सिफिलिस, आई थिंक इतना तक तो सबको पता होगा. शिस्टोसोमियासिस भी पता होगा, बट एंडोकार्डाइटिस, कार्डियक कॉज, फिलेरियासिस, इम्यूनोलॉजिकल कॉज में बी स्टिंग सबको पता होता है, बट द कॉजेस लाइक काइम्यूरा डिजीज, कैसलमैन डिजीज। ड्रग में सारे हैवी मेटल ड्रग्स पता होते हैं, बट इंटरफेरॉन एंड एनसेड्स, some of things are there which if you learn it properly you are able to answer with सिंप्लिसिटी इन द एग्जाम, you're श्योर ऑफ इट, ठीक है। सो ये चीजें उन लोगों को ही पता होती है जिन्होंने बहुत अच्छे से क्लास अटेंड किया है, जिन लोगों को बार बार पढ़ के रिवाइज करने का टाइम मिला है। सो डोंट फील बैड अबाउट एनीथिंग दैट द पेपर वाज लाइक बेसिक। Those who have attended it properly must have solved it with too much of happiness because the paper was very basic. Those who still found it difficult means you need a little more months of preparation. So the preparation level is same. सबको वहां तक पहुंचना होता है. So for that we are there to help you prepare to that level and to reach that level of your understanding and the preparation. So I'm glad that you marked folic acid as the answer. That is the right answer. ठीक है, सो प्लीज कीप प्रिपेयरिंग। इफ यू फील दैट यू हैव टू टेक एन अटेम्प्ट, डोंट वेस्ट एनी टाइम बिकॉज टाइम वापस नहीं आता। सो यू हैव टू बी रेडी फॉर द नेक्स्ट ईयर्स एग्जाम ऑल्सो, दोज हु थिंक दैट यू हैव टू टेक another attempt for the exam, ठीक है। So coming back to the topic, now secondary causes are those causes which can lead to the involvement of nephrotic. So we have got hepatitis B and C, we have HIV, we have malaria, we have syphilis, toxoplasmosis, endocarditis is very very important, schistosomiasis, filariasis and infectious mononucleosis, ठीक है। These are all the causes which can lead to the onset of infection, and as a reaction to this infection what can happen, the renal system can get damaged and the baby or the child can present with secondary cause of nephrotic syndrome. So जब भी हमारे पास कोई ऐसा पेशेंट आता है, what do we do? नेफ्रोटिक में we generally send the workup of viral markers and HIV, very very usual, ठीक है। This is usually done if we suspect that the age of presentation is atypical. So आगे slide में जब हम atypical presentation की बात करेंगे, you would know that this age of 4 to 6 years is very very common for your minimal change disease. So if you get any older child who is having nephrotic syndrome, we suspect that the cause might be secondary. So older बच्चों में या जहाँ भी atypical presentation होता है, it is very very important to rule out all these secondary causes of nephrotic syndrome. That is why we have to focus on this. From immunological disease, we have Castleman's disease, we have Chimera disease, we have bee sting and food allergy. Bee sting और food allergy सबको पता होता है. Again, I would try to make things like that. Chimera and Castleman's disease is going to be a little different thing to know. It can be asked in the exam also. Underlying neoplasia में we have got lymphoma and leukemia. So if you have any kind of underlying malignancy, it is a very very important finding that the child can go into nephrotic syndrome. So underlying malignancy is also very very important. Then drug induced में just remember all the heavy metallic drugs like your penicillamine, gold, mercury, lithium, all of them are responsible. What two things you should be very sure of is NSAIDs and interferon, okay? These are two important drugs again, your interferon and your NSAIDs, that can again lead to the onset of nephrotic syndrome. Okay, so ma'am, please provide mnemonics also. Regarding mnemonics, what I felt that what जो मैंने पढ़ाई करी थी अपने लिए for my PG exam and everything. So my trick is always to read from mnemonics. I don't learn and mug up so much. So I always make whatever funny mnemonics that is coming to my mind. So I try to share a lot of mnemonics, but I feel कि इतने सारे mnemonics बनाने से काफी बार confuse भी हो जाते हैं बच्चे. So I think you should get oriented to the text. And when we do the revision sessions, at that point of time, I will share all the mnemonics that I have made. So for secondary causes also, I have the mnemonics. I have the mnemonics for correlating the word association of diffuse with this gene, and everything is there. So word associations and everything that I will share when we do a marathon revision, because दोनों तरीके के approaches है students के. Most of the students feel that the text should be simple and oriented towards the course, and that is one feedback that I got. And some students feel very happy that ma'am had given the mnemonic and the problem is solved. अब तो मुझे याद हो गया ये. So both the things I'll do when I'm dealing for the first time with the unit, I'll teach you like a teacher. When I do the marathon revision at the end of the unit, then I'll teach you like a friend. Well, I'll share all the funny mnemonics and anything and everything that I've created, because हमें एज अ पेडियाट्रिशियन मुझे भी ये चीजें बहुत लंबे टाइम तक याद रखना पड़ता है. इट्स नॉट लाइक मुझे एग्जाम देना है एंड देन लेट गो ऑफ पेडियाट्रिक्स. सो आई हैव मेड मेनी मेनी mnemonics and word association. If you go to my past lectures that I've taken on cardiology, general pediatrics, you would find every session has got n number of mnemonics and word association. In fact, I advertise that I always teach with mnemonics and word association because that is one thing that helps you recall in the exam. But I have got feedback that the text should be plain and simple from the learners only. So once I do the initial teaching in detail, I'll just teach the topics. Once we do the revision and the MCQ solving, I'll help you remember things with the help of word associations and mnemonics. Okay. Alright, this slide is very, very important. It is going to consolidate all the types of nephrotic syndrome and all the findings that you get. So we have got minimal change disease, which is very, very important. तो मिनिमल चेंज डिजीज का नाम ही है मिनिमल चेंज डिजीज, मतलब इसमें कोई चेंज ज्यादा है नहीं, ठीक है. सो लाइट माइक्रोस्कोपी नॉर्मल है, इम्यूनोफ्लोरेसेंस नेगेटिव होता है, सिर्फ इलेक्ट्रॉन माइक्रोस्कोपी जो बहुत ही हाईली मैग्नीफाइड और रिफाइंड स्ट्रक्चर देखने के लिए यूज करते हैं, वहां पे आपको फूड प्रोसेसेस की फ्यूजन दिखती है, ठीक है. सो दिस एफेसमेंट इज गोइंग टू बी द कॉज फॉर द ऑनसेट ऑफ मिनिमल चेंज डिजीज. ऑलराइट, देन वी हैव फोकल सेगमेंटल ग्लोमेरुलोस्क्लेरोसिस. जैसा नाम है, फोकल है और सेगमेंटल है. दैट मीन्स in light microscopy, you will find that at some areas there is focal sclerotic lesions which is present. ये focal sclerosis क्यों हो रही है? क्योंकि immunofluorescence में you can see that there are certain deposits which are present. किस चीज के deposits है? IgM और C3 की, ठीक है. C3 is the most common complement levels that get deposited. So what is going to happen? You will find these depositions in your immunofluorescence stain that you put. So IgM or C3 deposits are present in depositions के वजह से you see areas of focal sclerotic lesion, कुछ यहाँ कुछ वहाँ, ठीक है. Electron microscopy पे obviously you will find foot process fusion because this is a type of nephrotic. Now these M वाली चीजें इसमें confuse नहीं होना है. So membranous nephropathy is like a membrane, ठीक है. membrane क्या होता है? A thick layer. तो membranous नाम ही हमने इसलिए रखा है क्योंकि इसका सब कुछ बहुत ही थिक दिखता है. So there's a thickened glomerular basement membrane that you find on light microscopy. इतना thick क्यों हो गया? क्योंकि there are very fine granular overloaded IgG which is present, ठीक है. So glomerular basement membrane thick है, there is G, so there is IgG. So these kind of tricks I use so that I also remember things for a long time. So it is to do with glomerular basement membrane. So GBM को thick करने के लिए हमें IgG बहुत सारा डालना है उसके अंदर, so that becomes like a foam. That is a membranous nephropathy. So too many of IgG for the GBM. So G से G हो गया, like that I used to remember. If you like the tricks, you can use it. Otherwise, I can keep the lecture very plain and simple also. तो ग्लोमेरुलर बेसमेंट मेम्ब्रेन के अंदर बहुत सारे IgG डिपॉजिट हो जाते हैं. बट वन इंपॉर्टेंट थिंग दैट यू गेट इन योर एग्जाम्स ऑल्सो, व्हाट इज द इलेक्ट्रॉन माइक्रोस्कोपी फाइंडिंग? इलेक्ट्रॉन माइक्रोस्कोपी में यू सी सब एपिथेलियल डिपॉजिट्स. नाउ मैंने ऐसे याद किया था, मेम्ब्रेनस है क्योंकि ये मेम्ब्रेन की तरह बिल्कुल फोम मैट्रेस की तरह बन गया बिकॉज ऑफ IgG. अंदर तो जगह है नहीं, तो डिपॉजिट कहाँ जाएगा? ऊपर ही जाएगा. सो इट इज सब एपिथेलियल, ठीक है. इट इज नॉट एंडोथेलियल, इट इज एपिथेलियल. ओके, सो दैट इज हाउ यू कैन कोरिलेट थिंग्स. सो देयर इज अ ट्रिक टू रिमेंबर एवरीथिंग. यू कैन रिमेंबर थिंग्स दिस वे. देन वी हैव मेम्ब्रेनो-प्रोलिफरेटिव ग्लोमेरुलोनेफ्राइटिस. अब इसमें दो टाइप होते हैं, टाइप 1 एंड टाइप 2. जो टाइप 1 है दैट इज ऑलमोस्ट सिमिलर टू द अबव टाइप, मतलब मेम्ब्रेनस का ही कॉपी होता है. इसमें बेसिकली क्या होता है? अगेन यू हैव अ थिक ग्लोमेरुलर बेसमेंट मेम्ब्रेन which has proliferated to this thickness, and then you find the deposits of both because it is membrano-proliferative. So इसका नाम भी बड़ा है, इसलिए IgG के साथ इसमें C3 भी ऐड हो गया, ठीक है. This is again like a thickened glomerular basement membrane जिसके अंदर बहुत सारे deposits हैं. So because it is a huge name, so it is membrano-proliferative. So इसके अंदर दोनों चीज के deposition है. You have IgG also and you have got C3 deposition as well, ठीक है. That is in type 1. Again electron microscopy में क्या मिलेगा? मेम्ब्रेनो-प्रोलिफरेटिव है, तो ये प्रोलिफरेट करते रहता है. अगर ये प्रोलिफरेट करते रहेगा तो इसके अंदर जगह बनती जाएगी. अगर जगह बनती जाएगी तो वी कैन हैव सब एंडोथेलियल डिपॉजिट्स. So that is how funny tricks that I use to remember things. I can share it with you, I don't mind. But mostly I'll restrict these tricks into my revision classes because I don't want everybody to get confused with the tricks also. So membrano-proliferative कहने का मतलब it keeps on proliferating. So if it keeps on proliferating, it can accommodate subendothelial deposits as well. Okay. Then in type 2, there is nothing. There are lobulations which is present. Only C3 deposits are there and dense deposits are present. So type 2 में basically dense deposits. 2 मतलब double, so dense and deposits is double D. So that is how I remember. Dense deposits are present in type 2. That is the lobulations which is present and only C3 deposits are there. क्योंकि 2 के बाद क्या आता है? 3. टू का बेस्ट फ्रेंड क्या है? 3. सो टाइप 2 में सिर्फ C3 है. डबल 2 है मतलब कि डबल D है, दैट मीन्स डेंस डिपॉजिट. सो दैट सॉल्व्स द होल मिस्ट्री ऑफ दिस स्लाइड. सो आई थिंक दैट वुड बी वेरी easy to remember for all of you. So this is the slide that accumulates and accommodates also all of the important findings that you get in your exam. What do you see in light microscopy? What do you see in your immunofluorescence? And what do you see in your electron microscopy? So those who are listening to the class, if you are able to understand the things, please leave a thumbs up. If you are understanding nephrotic syndrome. So next we have these important pictures which are to be discussed nicely. So we have got minimal change disease. So minimal change disease mein basically, as we had studied, there is effacement of the food processes. Okay, so effacement of the food processes mein basically you can see that the spacing in the food processes is present, but the basement membrane thickness is normal. So there is a normal basement membrane. Focal segmental glomerulosclerosis mein you can see that there are areas of sclerosis that is present. So once you see the HP examination, you will also find that there are areas of sclerosis that is present in and around over there. Then we have membranoproliferative glomerulonephritis. So membranoproliferative में हमने क्या पढ़ा था? मेम्ब्रेन है और प्रोलिफरेट कर रहा है. सो देयर इज सब एंडोथेलियल डिपॉजिट, क्योंकि जितना प्रोलिफरेट करेगा उतना जगह हो जाएगा उसके अंदर. सो दे कैन अकोमोडेट all these deposits inside because it is a huge name, so it has got the deposits of IgG and C3 both. ठीक है. So again you have type 1 and type 2. Type 2 में सिर्फ dense deposits होते हैं, that is your intramembranous deposits, but type 1 में you have got subendothelial deposits as well, and these deposits help to increase the density of the membrane. Then we have membranous nephropathy. जैसा नाम है membrane की तरह thick है, so you will find a very thickened basement membrane over here, and क्योंकि ये इतना thick है और फोम की तरह, तो इसके अंदर डिपॉजिट जाने का कोई चांस ही नहीं है. तो इसके डिपॉजिट्स कहाँ होते हैं? सब एपिथेलियल डिपॉजिट्स. ओके, सो डोंट गेट कंफ्यूज बिटवीन सब एंडोथेलियल एंड सब एपिथेलियल डिपॉजिट्स. दैट्स व्हाई these images to help you remember. Okay, so moving ahead now, that was a very long revision class, but because the topic is so important, so it's good that you read it a number of times and you get your concepts clear. Okay, now moving on to the pathophysiology. Very simple pathophysiology is there. What happens basically? Nephrotic पहली बात तो idiopathic है, that is the primary, or it can be secondary. तो जो भी होती है हमारी बॉडी में, देयर इज कॉम्प्लेक्स डिस्टर्बेंस इन द इम्यून सिस्टम. ठीक है. सबसे पहले अगर वो जेनेटिक प्रॉब्लम की वजह से है या फिर इडियोपैथिक कॉज की वजह से, देयर इज काइंड ऑफ सम प्रॉब्लम इन द इम्यून सिस्टम व्हिच इज basically the idiopathic thing, or any kind of mutation which we had studied which leads to congenital onset. So दोनों में से कोई भी चीज होगी, then what will happen in the body? The reaction goes on to the food processes. So renal system में जो हमारी glomeruli होती है उसकी इंजरी स्टार्ट हो जाती है. व्हाट इज द इंजरी? देयर इज इफेसमेंट ऑफ द फूड प्रोसेसेस. ठीक है, प्लीज रिमेंबर द वर्ड्स. देयर इज इफेसमेंट ऑफ द फूड प्रोसेस, जैसे मैंने आपको इमेजेस में अभी दिखाया था. Now because of this extensive effacement of the food processes, what will happen? अब इसकी effacement अगर हो जाएगी, so इसकी permeability और capacity जो होती है filter out करने की, जब हमारी body में glomeruli के पास जो भी proteins आते हैं, if they are larger proteins, it will return it back to the body, right? तो दैट इज व्हाट हैपेंस नॉर्मली. अब क्योंकि हमारे इम्यून सिस्टम या इम्यूनोलॉजिकल डिस्टर्बेंस की वजह से या किसी जेनेटिक म्यूटेशन की वजह से, इफ एनी काइंड ऑफ डिस्टर्बेंस हैज अकर्ड दैट हैज लेड टू दिस इंजरी in the body, then what would happen? Because of this injury, there is effacement of the food processes. Effacement होने की वजह से there is going to be increase in the permeability. जो फिल्टर का काम था इसका वो खराब हो गया. ठीक है. अगर फिल्टर खराब हो जाता है हमारे घर का, तो क्या होता है? सारे माइक्रो ऑर्गेनिजम्स हमारे पीने के पानी में आ जाते हैं. सिमिलरली अगर इसका फिल्टर खराब हो गया तो इट विल हैव इंक्रीज्ड परमेबिलिटी टू द ग्लोमेरुलर कैपिलरी वॉल. अब इसके फिल्टर खराब होने की वजह से क्या होगा? जो लार्ज साइज पार्टिकल्स थे वो भी फिल्टर आउट होके बाहर आ जाएंगे. So loss of proteins will occur. That is why we have this classical feature of proteinuria in nephrotic syndrome. ठीक है. So proteinuria is present. Why? Because उसका filter काम करना खराब बंद हो जाता है. So there is increased permeability because of the injury which was effacement of the food processes. So there is massive proteinuria. Massive proteinuria होने की वजह से क्या होगा? Body में albumin कम हो जाएगा. जैसे जिसका कट ऑफ हमने क्या पढ़ा था 25 grams 2.5 grams sorry per deciliter. So once the albumin starts to fall, there's disturbance in the oncotic pressure, because of which there is fluid retention in the body, leading to the classical presentation of edema known as anasarca. सब कुछ फिट हो गया इसके अंदर. There is anasarca, there is hypoalbuminemia, there is proteinuria, and there is classical injury that we have seen in the last slide, that is effacement of the food processes. This is the classical pathophysiology that occurs in your nephrotic syndrome. Okay. Now it is also said that out of the pathophysiology, we have two important things. One is the underfill hypothesis, and the another one is the overfill hypothesis. So let's see, very basic concept it is. Underfill में क्यों क्या होता है? Edema का reason क्या है? Now when there is heavy proteinuria, what was happening? Because of loss of protein, हमारी body में protein कम हो गया. That means there is decreased albumin. ठीक है. Now if the albumin is decreased, what will happen? There is decreased plasma oncotic pressure. Now protein कम होने के वजह से जो plasma oncotic pressure है, that falls. So once there is decreased oncotic pressure, what will happen? There is transudation of fluid from intravascular to the interstitial space. So there is going to be fluid disturbance. ठीक है. oncotic pressure गिरने के वजह से क्या होगा? Once the oncotic pressure has fallen, it will lead to transudation of fluid from the intravascular space into the interstitial space. So this is going to lead to decreased circulating volume. क्यों? क्योंकि आपका intravascular part has decreased volume now. So decreased volume of the intravascular part. ठीक है. This is very important topic. Please remember the pathophysiology very crystal clear. Decreased intravascular volume is going to occur. So जिसके वजह से हम इस hypothesis को क्या कहते हैं? Underfill. ठीक है. अगर आपका volume कम हो गया, then what is going to happen? Underfilling. Underfilling की वजह से हमारी body में क्या होता है? अंडरफिलिंग की वजह से हमारा रास सिस्टम एक्टिवेट होता है. तो रेनिन एंजियोटेंसिन सिस्टम इज गोइंग टू गेट एक्टिवेटेड. जैसे ही एक्टिव होगा, व्हाट इज गोइंग टू हैपन एज द इमीडिएट रिएक्शन? It is going to lead to increased aldosterone and increased vasopressin that will go and cause the sodium and water retention. So once the water is retained in our body, what will happen? It will lead to edema. So that is the cause of edema that occurs in your nephrotic syndrome. So underfill hypothesis का मतलब क्या है? That there is heavy proteinuria, which was the cause due to effacement of the food processes. Because of this, there was hypoalbuminemia. This decreased albumin had led to decreased plasma oncotic pressure. Because of the fall in the plasma oncotic pressure, there was disturbance in the intravascular volume, due to which the transudation of fluid had occurred from the intravascular part. So intravascular volume कम होने की वजह से इस hypothesis को हम underfill volume theory कहते हैं. जैसी underfilling होती है, decreased volume की वजह से your RAS system gets activated. If it gets activated, you will get elevated aldosterone or elevated vasopressin, जिसकी वजह से आपका fluid and water retention होता है and the patient goes into edema. There's another hypothesis that tells it is because of overfill theory. So overfill में क्या हो रहा है? Now there is heavy proteinuria that we all know. Because of the increased permeability, there is loss of albumin. Okay, so once the albumin is lost, what will happen? There is hypoalbuminemia. So there is low plasma oncotic pressure that has led to edema, which we have just seen. Another thing that can happen is proteolytic enzymes would start to enter the tubular lumen. तो हैवी प्रोटीनूरिया होने के वजह से जो एंजाइम्स है दैट कैन स्टार्ट टू एंटर द ट्यूबुलर ल्यूमेन एज वेल. नाउ यहाँ पे हमारे पास होते हैं इनैक चैनल्स. इनैक चैनल्स क्या होते हैं? दे आर एपिथेलियल सोडियम चैनल्स. सो दीज गेट एक्टिवेटेड बिकॉज ऑफ दीज एंजाइम्स व्हिच हैव एंटर्ड. इसके वजह से देयर इज इंक्रीज्ड ब्लड वॉल्यूम. नाउ दिस इंक्रीज्ड ब्लड वॉल्यूम इज द ओवरफिल थ्योरी that is said that happens in nephrotic, and because of this overfill, again because of the increased blood volume that is coming, that leads to edema as well. There is intrinsic resistance of the kidney to ANP as well. So because of this, the overfill theory gets all the more activated. So activation of this overfilling can lead to direct edema. So this is also one hypothesis. You should just be aware of this. But the most important theory and the most important concept that is the cause of nephrotic is the underfill hypothesis, that is due to disturbance in the plasma oncotic pressure. But there is another hypothesis that you should be aware of, which is the overfill hypothesis that runs around the ENaC channel activity. All right. Okay, so another table which is going to again consolidate all the important findings of all the types of nephrotic that we have discussed. So हमने 5 idiopathic types पढ़े थे, है ना? There were 5 idiopathic classifications of nephrotic which needs to be learned very nicely. So we have minimal change nephrotic, we have focal segmental glomerulosclerosis, we have membranous, and we have membranoproliferative 1 and 2. ठीक है? So let's see what is the presentation in each of them. So in this basically, now let us see about minimal change disease, what is going to happen. So minimal change disease, as I told you, the school going age is the most common age of presentation that happens. So the age is classically between 2 to 6 years of age. So between 2 to 6 years of age, the maximum incidence, if you find a type of nephrotic syndrome, it is generally the minimal change type of nephrotic syndrome. Focal segmental glomerulosclerosis कब होता है? Focal segmental glomerulosclerosis is seen a little late. Late कहने का मतलब this is one thing that we consider as an atypical presentation. So इसकी age group थोड़ी ज़्यादा होती है. That means it can go beyond the school presenting age, that is 2 to 10 years. Membranous nephropathy is classically seen in old age. It is not very common in pediatrics. It is most commonly due to underlying malignancy that is there in the body, which is seen in the old age group. But we have two types, MPGN1 and MPGN2. So these are seen in a period of 5 to 15 years of age. ठीक है? So most important जो question आता है आपका minimal change के ऊपर आता है. Please remember the age duration. It is the school going age most commonly, that is 2 to 6 years. Focal segmental is also common in pediatrics, but that extends beyond the common presentation age, that is it can happen from 2 to 10 years of age. Membranous old age में होता है, most commonly it is seen with underlying carcinomas. And then we have MPGN1 and 2 जिसका age of presentation can extend up till 15 years of age. Okay. Now regarding the gender predisposition, so minimal change is more common in males. In fact, you would see most of the males are the patients who have got minimal change disease. So it is more common in males. FSGS is also more common in males. Membranous is also more common in males. But membranoproliferative can affect anyone. That means it has equal predisposition in both males and females. So development of nephrotic syndrome. If it is minimal change disease, it is 100% that the presentation will be nephrotic range proteinuria. If it is FSGS, 90% it would be nephrotic, 10% could be atypical presentation, or it can go towards nephritic also. Membranous nephropathy, again 80% cases would be classical nephrotic syndrome. But in MPGN1 and 2, it is not sure that you would always have a presentation of nephrotic range that we have studied. So asymptomatic proteinuria is only seen most commonly in MPGN1 and 2. It is going to be highly symptomatic and reactive in the other types, which we have already studied the classical presentation of proteinuria, that is edema and generalized anasarca and hypoalbuminemia. So that would be present in almost all of them, but asymptomatic proteinuria could be a feature of MPGN1 and 2. Hematuria is not classically seen in any type of nephrotic syndrome except the most atypical type, as I told you, since beginning it is FSGS. So focal segmental glomerulosclerosis, ऐसे याद रख सकते हो, इसमें sclerosis हो रहा है, so there is damage which will react as hematuria. So that will help you remember that FSGS is the type which can still have the presentation as hematuria, otherwise it is not present. So जो हमारा question आया था, that was the age of presentation was classical for minimal change disease, and do you see hematuria is very rare. Since blood cells were not present, it was having lipid-laden cells, and also proteinuria was present and edema was present. So the answer to that question was nephrotic syndrome. Okay, again because most atypical type, that is MPGN1 and 2, जहाँ सब कुछ ही different है, there also you can have hematuria presentation. Hypertension again will not be present in minimal change disease. It can be present in MPGN1 and 2. रेट ऑफ प्रोग्रेशन टू रीनल फेलियर सबसे ज्यादा जो होता है that is very common with FSGS type. Again, you can correlate क्योंकि इसमें sclerosis हो रही है, so renal damage is too much. So you can just imagine that rate of progression to renal failure is very common with FSGS type. And in membranous it can occur because एक तो old age में हो रहा है and दूसरा underlying malignancy का reaction है, so definitely renal failure can occur in most of them, and also in MPGN1. So FSGS is one in pediatrics. If you find it, you can have renal failure onset as well. Lab findings we have seen, complement is not seen in minimal change disease, there is no deposition. In FSGS also there is minimal deposition. Complement is also normal in membranous, but in MPGN you will find C1, C4 and from C3 to C9 which is low. And in MPGN2, it is classically the MAC complex, that is mostly from C3 to C9, that is low. Otherwise, you have normal levels of complement 1 and 4. So you would be asked only about the deposition of complements in these types, that you should be very aware of कि किसमें complement deposition है और किसमें नहीं है. So this table and chart is also very important, where you can easily consolidate all the findings of all the types of nephrotic syndrome so that it does not create any confusion during the exam. So again, let's just see very fast. Age of presentation for minimal change disease is the school going age, that is 2 to 6 years. For focal segmental, it is 2 to 10 years. For membranous, it is old age, that means 40 to 50 years. जहाँ पे carcinoma underlying जो होता है, that is the most common cause. And for MPGN, you have 5 to 15 years. So focal segmental का age of presentation बहुत important है क्योंकि this is atypical. Sex predisposition में all of them are more common in males, apart from MPGN 1 and 2, which can be equal in both. Nephrotic range is seen in all except MPGN, which can also present with nephritic range. Asymptomatic proteinuria is only seen in MPGN, rest all of them would have symptomatic proteinuria. Hematuria again can be present in the atypical type, that is FSGS, and your MPGN types. Hypertension again is seen in your MPGN types. Rate of renal failure progression is common in FSGS type. Approximately after 10 years, the child would go into renal failure, and also it can be seen in MPGN1 type. Regarding the complements and the lab findings, you find low levels of complement C1, C4 and the MAC complex of C3 to C9, which is low in MPGN type 1, and in type 2 you classically see low levels of C3 to C9. So this is all that you need to remember from the complete types of idiopathic types of nephrotic syndrome. Okay, now since we have studied the etiology and the pathogenesis and we have understood what is happening in nephrotic, now comes the clinical approach to nephrotic syndrome. Okay, so clinically हमें कैसे approach करना है? So clinical approach में सबसे पहले है आपको investigate क्या क्या करना है. So to confirm that it is nephrotic, you have to do a detailed urine analysis. Urine analysis में क्या करना होता है? सबसे पहले तो protein levels देखने हैं. What is the loss of protein? Red cells हमें देखना है to rule out presence of hematuria. Cast cells हमें देखने कि lipid laden है या infective है. Spot urine protein creatinine ratio क्योंकि ये diagnostic criteria है. UPUC being more than 2. That is very, very important. You also have to see the renal function, whether it is going towards renal failure or not. So urea creatinine, albumin less than 2.5 is the criteria. So we have to see albumin. Cholesterol more than 200 is the criteria. So we have to see cholesterol. Beyond this, CBC is very important so that you can rule out any infection. अगर कोई infection होता है patient में, then we cannot give the patient the classical dose of steroid that is given for the treatment. And Cox workup is very, very important. Why? Can anybody tell me in the chat box? Why do we rule out TB before starting? This is your homework question that you would answer me in the next session. TB rule out करना क्यों important है in nephrotic syndrome? Okay. Now, if required, you also have to rule out other causes of nephrotic. So for this, we do all the important causes that we had studied regarding the secondary onset of nephrotic syndrome. So इसके लिए हम complement levels कर सकते हैं, that is your C3 and C4 levels. You can also do ASO titers to see if the patient is having acute streptococcal infection or a case who has having a rising titer of ASO titers, that means there is an onset of streptococcal infection which can lead to microscopic hematuria as well. So we need to do the recent onset of infection as well. All the tridot we need to do because all of them are responsible for the secondary causes of nephrotic. Any autoimmune phenomena, उसके लिए हम ANA कर सकते हैं. Urine culture we need to do to rule out if the child is having any UTI or not. Ultrasound abdomen to rule out any congenital anomaly of the renal system and what is the alteration in the echo texture and the medico-renal disease or whatever loss that has happened to the structural scarring and everything. For that we can do ultrasound. And finally, if you're not able to make the diagnosis and you strongly feel it could be an atypical type, apart from minimal change, that is focal segmental or MPGN, then we have to do a renal biopsy to confirm the histopathological type of nephrotic syndrome. Okay, a 5-star topic. What are the indications for renal biopsy? कब कराना होता है हमें renal biopsy nephrotic में? When do we do a renal biopsy? क्या हम सारे बच्चों की renal biopsy करते हैं? Obviously, no. Not every child suspected of nephrotic syndrome has to undergo a renal biopsy. So, when do we do a renal biopsy? So, biopsy is a very important investigation. क्यों करते हैं हम biopsy? To confirm the disease or the clear the confusion that we have regarding the diagnosis. So, this is the most confirmatory test. So, obviously, हम तब करेंगे जब हमें diagnosis को लेकर dilemma है. So, if a child presents with nephrotic but the age is very atypical, that is less than 1 year. हमने कब से पढ़ा था? 2 to 6, 2 to 10 years, 5 to 15 years. So school going age में ज़्यादा common होता है. So if the child is very very young, that means if the age of the baby is less than 1 year of age. We all know that nephrotic presents with with proteinuria. So if you have gross hematuria or you have persistent microscopic hematuria or you have persistent low complement levels, so this atypical presentation demands a diagnosis. So in this case, we need to do a renal biopsy to confirm what is the type of nephrotic syndrome that is present. Okay. If a child is having sustained hypertension, इसका मतलब क्या है? ये nephritic की picture में fit हो रहा है, ठीक है? So to rule out the diagnosis and to confirm the type and the atypical presentation, because we have seen hypertension and hematuria can be present in focal segmental and MPGN type also. तो minimal change के अलावा बाकी जितने भी है सारे ही atypical में ही आते हैं logically, because they all have various range of presentation. So sustained hypertension अगर कहीं पे है, then you have to again do a renal biopsy to confirm the diagnosis. If renal failure is not attributable to hypovolemia, so if the amount of volume loss and the underfill theory that we have studied does not explain the clinical presentation, and the child has renal failure, then we need to do a biopsy to confirm a diagnosis. If there is suspected secondary cause of nephrotic syndrome, obviously if you don't find that it is idiopathic and you suspect that the secondary cause could have led to this damage and there is nephrotic syndrome, then again to confirm your diagnosis, you have to do the renal biopsy. So these are all the classical indications for doing a renal biopsy. Okay. Now, another indication is if after your treatment, the proteinuria still persists despite of giving full dose steroid therapy for 4 weeks and you don't know what is the cause, then to rule out the atypical presentation, we have to do again a renal biopsy. And before starting the treatment with second line drugs, that is cyclosporin and tacrolimus, we again have to do renal biopsy. So these are all the classical indications for doing a renal biopsy in the case of nephrotic syndrome. Please learn it up very, very properly. It is very understandable also, you don't need to ratify it exactly. अगर एज एटिपिकल है, प्रेजेंटेशन एटिपिकल है, सिंपल कंसेप्ट. एज लेस देन 1 year है, प्रेजेंटेशन में आपको प्रोटीनूरिया के अलावा परसिस्टेंट हाइपरटेंशन मिल रहा है, परसिस्टेंट हेमेचूरिया मिल रहा है, रीनल फेलियर मिल रहा है, या आपको लग रहा है कोई सेकेंडरी कॉज हो सकता है, देन यू हैव टू डू अ रीनल बायोप्सी टू कंफर्म दैट यू आर डीलिंग विद नेफ्रोटिक सिंड्रोम. Treatment wise, if your patient has not responded to the classical treatment, again it's atypical presentation, so you have to do renal biopsy. And before starting the second line drugs, you should be sure that you're dealing with atypical type of nephrotic, so you have to do a renal biopsy. Now, another very important topic that can be asked in your exam, has been asked a number of times, is the definitions of nephrotic syndrome. There are various terms which are used in this nephrotic. So you should be clear with all the definitions that have been asked. So what are the important definitions and important things that you should be aware? First thing is, what is nephrotic? There's a term known as complete remission. That means when do you call that a patient has gone into complete remission or has been treated properly? Then there is something known as partial remission. When do you say that the child has not responded to your treatment and has gone into partial remission? Then you have no remission. Okay, so this is in terms of your treatment response. Then you have initial responder. Then you have initial non-responder, that means steroid resistance nephrotic, which is a hot topic in your exam. Then we have what is known as a relapse. In relapse, then you have infrequent and frequent relapse, and you have something known as steroid dependence. एक था आपका steroid resistant और एक है आपका steroid dependent and a late non-responder. तो जैसे नाम है वैसे ही definitions है, इतना confusing नहीं है, but बहुत ही scoring topic है ये, because if you are clear about the definition, you can know what to choose in between the options. Nephrotic हमने पहले पढ़ लिया, presence of edema. with protein range being of nephrotic range proteinuria. That means your urine dipstick is more than equal to 3 plus. There is hypoalbuminemia of less than 2.5 grams per deciliter, and you're having a UPUC ratio of more than 2. Okay? So UPUC being more than 2, dipstick being more than equal to 3 plus, hypoalbuminemia less than being 2.5 grams per deciliter, all associated with edema. This is known as nephrotic syndrome. Next, you have to know what is complete remission. Remission का मतलब क्या? आपने treatment दिया and the child has responded. इसका मतलब क्या है? If the UPUC ratio has become less than 2, more than 2 was the criteria. So अगर वो less than 2 बन जाता है, or your dipstick proteinuria has become less than 1 plus for 3 consecutive days. What is more important? If this finding is present for 3 consecutive days, then you can say that the child has gone into complete remission. ओके, प्लीज रिमेंबर जो हमने पढ़ा था नेफ्रोटिक का डेफिनेशन वो क्लियर आउट हो गया. मतलब यूपीयूसी रेशियो आपका 2 से कम हो गया, प्रोटीन लेवल्स जो डिपस्टिक पे आ रहे थे वो 1 प्लस से कम हो गए. If this thing happens for 3 consecutive days, it is complete remission. What is partial remission? If your proteinuria reduction जो हम complete में expect कर रहे थे, that reduction has occurred of 50% or greater from the presenting values and the UPUC ratio has not fallen to less than 2. मतलब जो हम expect कर रहे हैं complete remission का अगर 50% हो गया, उसको हम कहते हैं partial remission. No remission किसे कहेंगे? If the reduction in protein level excretion has not occurred to even 50% from the baseline. कंप्लीट रेमिशन कहने का मतलब यूपीयूसी रेशियो लेस देन 2 एंड डिपस्टिक बीइंग लेस देन 1 प्लस फॉर 3 डेज. वेरी सिंपल. पार्शियल रेमिशन जो हम एक्सपेक्ट कर रहे हैं उसका 50% अगर अटेन हो गया, देन द पेशेंट हैज गॉन इनटू पार्शियल रेमिशन. व्हाट इज नो रेमिशन? इफ इवन देयर इज लेस देन 50% फ्रॉम द बेसलाइन, दैट मींस देयर इज नो रेमिशन. क्लियर विद दीस थ्री टर्म्स? लेट्स सी द रिस्पॉन्स. इनिशियल रिस्पॉन्डर किसको कहते हैं? इनिशियल रिस्पॉन्डर मतलब जिसने ट्रीटमेंट को रिस्पॉन्ड किया है. So attainment of complete remission within the first 4 weeks of steroid therapy. Please remember the numericals, favorite topics of NEET PG exam, number based questions. So 4 weeks of corticosteroid therapy में if a patient has gone into complete remission, उसको हम initial responder कहते हैं. Okay? Initial non-responder किसको कहते हैं? Obviously failure to achieve complete remission. But after 8 weeks, we'll wait and watch for the complete course. तो इसका double कर दो. 8 weeks के इंतजार के बाद भी if the child has not gone into complete remission, then we call it a non-responder. Alright, so this is basically your steroid resistant type. मतलब आपने steroid दिया, 8 हफ्ते तक वेट किया, फिर भी child has not responded, so that becomes steroid resistant. No, responder में the child responds within the initial 4 weeks of steroid therapy. So initial responder and initial non-responder. Clear? Let's move ahead. What is a relapse? So relapse का मतलब क्या है? जो ट्रीटमेंट किया वो बेकार किया. That means again the child has gone into nephrotic. Simple. So क्या हो गया उसका? UPUC रेशियो वापस 2 हो गया या डिपस्टिक मोर देन इक्वल टू 3 प्लस हो गया और फॉर 3 कंसेक्यूटिव डेज डिस्पाइट ऑफ गिविंग द ट्रीटमेंट. वेरी सिंपल. रिलैप्स का मतलब क्या है? जो डेफिनेशन हमने पढ़ा था वो वापस सीन में आ गया. यूपीएससी रेशियो 2 से बराबर इंक्रीज हो गया और प्रोटीन डिपस्टिक जो है वो मोर देन इक्वल टू 3 प्लस हो गया फॉर 3 कंसेक्यूटिव डेज. नाउ रिलैप्स में दो चीजें होती है. व्हाट इज इनफ्रीक्वेंट एंड व्हाट इज फ्रीक्वेंट. इनफ्रीक्वेंट मतलब जो कम ड्यूरेशन में हो रहा है, सॉरी जो ज्यादा ड्यूरेशन में हो रहा है. मतलब if there is episode of one relapse within 6 months और 1 to 3 relapses in any 12 months period, या तो 6 months में एक बार relapse हुआ पेशेंट को या 12 months period में 1 to 3 relapses has occurred. So single relapse in the first 6 months or multiple relapses in any 12-month period, उसको हम कहते हैं infrequent relapse. Frequent relapse का मतलब क्या हो गया? Just the double. Initial 6 months में ही if the child faces more than equal to 2 relapses, so more than equal to 2 relapse in the initial 6 months or 4 or more relapses in any 12-month period, just double of infrequent, that becomes your frequent relapse. ठीक है? Relapse का definition clear है? Relapse का मतलब क्या? जो मेहनत हमने करी उस पर पानी फिर गया. That means the child has again gone into nephrotic syndrome during your treatment. So definition क्या था nephrotic का? UPUC being more than 2 and dipstick being more than equal to 3 plus. So if this happens with treatment for 3 consecutive days, जो हमने remission में उल्टा पढ़ा था, if less than that happens for 3 consecutive days, तो वो treat हो गया. अगर ये चीज दोबारा हो गई ऑन ट्रीटमेंट तो वो रिलैप्स हो गया. ठीक है? सो यूपीयूसी बीइंग मोर देन 2 और डिपस्टिक बीइंग मोर देन इक्वल टू 3 फॉर 3 कंसेक्यूटिव डेज, देन यू हैव अ रिलैप्स. इनफ्रीक्वेंट कब होता है? 6 महीने में एक बार या फिर 1 to 3 times in any 12 months period. ठीक है? Frequent क्या हो गया? Just double of it. 2 relapses in 6 months or 4 or more relapse in any 12 months period. Is it clear? रेमिशन समझ आ गया, रिलैप्स समझ आ गया. देन स्टेरॉइड डिपेंडेंट किसको कहते हैं? मतलब वो स्टेरॉइड पर डिपेंडेंट है. दैट मीन्स इफ देयर इज 2 कंसेक्यूटिव रिलैप्सेस ड्यूरिंग स्टेरॉइड थेरेपी और विद इन 4 वीक्स ऑफ स्टॉपिंग द थेरेपी. स्टेरॉइड चाहिए उसको, अगर स्टेरॉइड हट गया तो वो रिलैप्स में चला जाएगा. दैट मीन्स 2 consecutive relapses during steroid therapy, or once you stop steroid within 14 days of that, if the child goes into relapse, that is a steroid dependent relapse. Okay. And final definition, a very rare definition, what is a late non-responder? If there is persistent proteinuria during 4 or more weeks of steroid following 1 or more remission, that is a late non-responder. That means has responded but it is a late, had not responded but it is a late non-responder. That means proteinuria is present during the 4 or more weeks of steroid therapy following the remissions. Okay? So first definition of nephrotic should be very, very clear, which we have seen in the first slide as well. Then beyond nephrotic, what is remission? उसका उल्टा कर दो. Complete or partial or no remission. Complete मतलब जो criteria that is fulfilled. Partial मतलब reduction of 50% or more, and no means less than equal to 50% reduction. Then we have definitions on response. That is your initial responder and initial non-responder, जिसको हम steroid resistant भी कहते हैं. Response मतलब if that target is achieved of remission in the first 4 weeks. Non-responder matlab that target is not achieved even in the first 8 weeks. Relapse means what? Just the opposite of that. If again the definition has come up and your treatment has gone a waste. So if that happens for 3 consecutive days, that means UPUC becomes more than 2 and the urine dipstick is more than equal to 3 plus for 3 consecutive days, that becomes a relapse. Infrequent relapse, 1 in 6 months, or 1 to 3 in 12 months period. Frequent relapse, just double of it. 2 or more relapses in 6 months and 4 or more relapses in 12 months period. Steroid dependence means if there is 2 relapse during therapy or within 14 days of stopping the therapy, that is steroid dependence. And late non-responder, if there is persistent proteinuria during the 4 or more weeks of corticosteroid following 1 or more remissions. So these are very, very important definitions. Anything can be picked up in the exam. So please be thorough with these definitions, understand them, and that will be helpful for remembering it for a long time. Okay, so we have seen the clinical approach, we have seen everything, etiology, pathophysiology. Now coming towards the treatment and the management of nephrotic syndrome. So something known as FENS. FENS क्या है? First episode nephrotic syndrome. So first time a child presents with nephrotic, what will you do? Now the latest guidelines say that you have to give 6 plus 6 course. That means you have to give it for at least 12 weeks. Steroid therapy has to be given for at least 12 weeks duration. You have to give single dose of prednisolone at the dose of 2 mg per kg per day. Limiting dose is 60 mg per day. You can be asked this question also. So please be careful that the limiting dose is 60 mg per day. You have to give it for 4 to 6 weeks. So many articles mention it is 4 weeks. Many articles say it is 6. So classical that we take is 6 plus 6 weeks. So please remember for 6 weeks you have to give steroid at the dose of 2 mg per kg per day. The ceiling dose is 60 mg per day. After you finish the 6 weeks course, you have to give alternate day steroid therapy at the dose of 1.5 mg per kg. The ceiling dose for which is 40 mg. And then you can continue the tapering of this for 2 to 5 months with the minimizing of the dose. So total duration, if you are asked, please mention it at 12 weeks. That is 6 plus 6. Okay? So that is the exact treatment. पहले 6 में हमें 2 mg per kg per day से देना है, maximum dose 60 है. Next 6 weeks में हमें 1.5 mg per kg से alternate दे देना है, maximum dose is 40 mg. Alright. Now, apart from first episode nephrotic syndrome, what else can be asked is the treatment of relapsing type of steroid sensitive nephrotic syndrome. तो रिलैप्सिंग कब होती है? स्टेरॉइड सेंसिटिव नेफ्रोटिक सिंड्रोम में. इसमें इसके अंदर दो चीजें हैं, एक फ्रीक्वेंट है और एक infrequent relapse है. The definitions which we have seen right away, it is based on the duration of relapse. So let's see what to do in infrequent relapses of steroid sensitive nephrotic syndrome. So in frequent relapse में what we do, once the patient goes into relapse, we again have to treat with the single dose of prednisolone with the same dose, that is 2 mg per kg per day, the ceiling dose being 60 milligrams per day, until the child has gone into complete remission for 3 days. So हमारा target क्या होता है steroid देने का? Our target is to bring the child into a phase of remission. उसका टारगेट अचीव होना चाहिए, दैट इज फॉर 3 consecutive days द चाइल्ड शुड हैव अचीव दैट टारगेट ऑफ यूपी-यूसी रेशियो बीइंग लेस देन 2 और द यूरिन डिप्स्टिक बीइंग लेस देन 3 प्लस, सॉरी 1 प्लस. So that is what is the target for remission. So जब तक complete remission 3 दिन के लिए लगातार ना attain हो जाए, you have to continue giving this dose in form of steroid. Then once this target is attained, you can shift on to single dose of alternate day, again at the dose of 1.5 mg per kg, limiting dose being 40 mg for at least 4 weeks. ठीक है? तो infrequent relapse में हमें क्या करना है? वापस से ट्रीटमेंट स्टार्ट करनी है. कब तक करनी है? We'll give 2 mg per kg, ceiling dose being 60 mg, till the child goes into complete remission for at least 3 days. Once the child has attained complete remission, you can shift back to the single dose of alternate day course with a dose of 1.5 mg per kg, ceiling dose being 40 mg for at least 4 weeks. That is the treatment for infrequent relapsing steroid sensitive nephrotic syndrome. Then we have frequent relapsing nephrotic syndrome and steroid dependent nephrotic syndrome. इस केस में क्या करना है? Now, if it is frequently relapsing, that means that the child is dependent on steroid. So that means daily prednisolone until the child has been into remission for at least 3 days. That means complete remission is attained for 3 days, followed by the same alternate day steroid therapy in the lowest possible dose. Lowest possible dose हमें decide करनी होती है with the tapering of the dose for at least 3 months duration. ठीक है? So that is for frequent relapsing nephrotic syndrome. You have to again start with the daily prednisolone dose till the child attains the complete remission for 3 days. Now, because it is frequent relapsing, that means the child is steroid dependent. You cannot taper and stop the steroid. What you have to do for frequent relapsing, you will shift the child on alternate day steroid therapy with the lowest possible dose. जैसे जैसे आप टेपर करोगे, जब तक वो रेमिशन कंटिन्यू हो रहा है, वो डोज आपको डिसाइड करके रखना है कि कितने लोवेस्ट डोज पे द चाइल्ड इज एबल टू मेंटेन अ रेमिशन फेज. That dose you have to continue for a longer duration, that is approximately 3 months, so that the child does not go into relapse again, because frequent relapsing matlab that child is dependent on the steroid, like we have discussed this frequent relapsing and we have discussed steroid dependency. So because of this dependency, you have to follow this regimen. Daily prednisolone is given at the lowest dose to maintain the remission where alternate day prednisolone therapy is not effective. So whatever minimum dose that you have seen on tapering, that this is the dose at which the child is able to stay in the remission phase, you have to continue that dose for 3 months. Now, apart from this, we cannot continue giving only steroids, so we have to add steroid sparing agents. These are the second line drugs that we use in the management of nephrotic syndrome. So second line drugs हमें क्या add करने होते हैं? Now there are many drugs that are there which can be added as the second line drugs in the treatment of frequent relapsing. So you should know at least the name, the dose and the side effects. इतना आपको पता होना चाहिए, because if you get a recent update question or if you get an altered question, you can be getting questions from the drug doses as well and the side effects also. So corticosteroid sparing agents are used for frequent relapsing type of nephrotic syndrome and steroid dependent type of nephrotic syndrome, who at the minimum dose start to develop the side effects of steroids. So last slide I have put for the side effect of steroids because that is very important. You should be well aware of all the side effects of steroid that occurs. So these adverse effects basically develop in those children who are taking steroid for a longer duration of time. So उन steroid के side effects को prevent करने के लिए we add a second line drug in the treatment regimen. So we use a lot of drugs. So you don't need to go too much in detail of the drugs, but basic names, the dose that you have to use and what are the side effects, that is all that I've put for you guys. So first drug or the second line drug that we use is cyclophosphamide. ठीक है, cyclophosphamide का dose क्या होता है? It is 2 mg per kg per day. You have to give it for just the double dose. That means 4 का 8 कर दो. 8 weeks के लिए you have to give this supportive treatment. It should not be started until the child has achieved remission with corticosteroids. So ये second line drugs हम कब start करते हैं? We started once the child has attained the remission phase and you have been able to put successfully the child at a minimum dose of steroid in which the child is able to stay in the remission phase. उसके बाद हमें second line add करना होता है so that prolonged steroid therapy के वजह से they don't develop the side effects. So this should never be started until the remission is not documented. Okay. So we give prednisolone alternate day for 4 weeks. Then we cut it short to tapered doses, and we have to stop it within 3 months. So maximum duration we give it for 3 months that we have already discussed in steroid dependent type. So with cyclophosphamide, the most important thing is TLC monitoring. Why? It can fall down. So you have to do a leukocyte monitoring every 2 weeks. You have to get the CBC done for the patient on every 2 weeks duration. So side effects आपको याद होने चाहिए that TLC can fall down and you have to discontinue if it falls down below the normal range. Side effects are very very important. Cyclophosphamide का एक important side effect जो हमेशा आता है question में that is hemorrhagic cystitis. ठीक है. So cyclophosphamide start करने से पहले हमें hydration देना होता है patient को. So hemorrhagic cystitis and gonadal toxicity. Please remember these two are very very important side effects of cyclophosphamide. So you have to limit the intake of these drugs if the patient is already compromised on these features, and you have to increase the fluid intake and hydrate the patient properly before starting this treatment. Okay. So cyclophosphamide में इतना ही जरूरी है आपको याद रखना. Then we have calcineurin inhibitors, very important drugs as the second line treatment for nephrotic. Calcineurin inhibitors में we have cyclosporin. Cyclosporin is the most important drug that we give. Cyclosporin का dose होता है 4 mg per kg. ठीक है. Cyclosporin is 4 mg per kg. Cyclophosphamide was 2 mg per kg. This again you start to give daily for a maximum of 12 to 24 months. This is a safer drug. You can use it easily. It's not as toxic as cyclophosphamide. So cyclosporin is again used with the steroid. So steroid जब हमने start किया, we start to taper it off and then we stop it at the maintenance dose at which the child is able to go into complete remission. Okay. And once the child has started on cyclosporin, you can also discontinue the steroid therapy that you have given. So what are the important side effects? Side effects cyclosporin ka you all must have read it in pharma also. So very important, it is gum hypertrophy, hirsutism, nephrotoxicity, and elevated liver and lipid profiles. Okay, please remember these important things. Cyclosporin has got all the hypertrophy features. It increases the gum hypertrophy, it increases the hormonal disturbances causing hirsutism, it causes renal toxicity, it can increase cholesterol, and it can increase your liver functions also. So monitoring में हमें KFT, LFT as well. KFT, LFT and lipid profile you have to monitor very regularly so that you can rule out these complications in the patient. Okay. And as I told you, in the indications of renal biopsy, before starting your cyclosporin treatment, you have to do a renal biopsy as well. Okay. Third drug that you should be aware of is tacrolimus. So this drug is also a second line drug which is available for the treatment of nephrotic. Its dose is 0.1 to 0.2 mg per kg. It can also be given for a prolonged duration, which is being on a safer side, at least for 12 to 24 months to see the response of the child. Side effects for tacrolimus is, please remember, hyperglycemia. So tacrolimus causes hyperglycemia and it can also lead to diarrhea. That is all, but hyperglycemia is very very important. Now it is basically used in the adolescent or the patients who have atypical presentation like FSGS and MPGN types, because the age group is different for these. They are present from 10 to 15 years. So you are mostly using tacrolimus in the adolescent age group. Serum creatinine and glucose monitoring is important because the most common side effect is hyperglycemia. So hyperglycemia monitor करने के लिए you have to see the RBS levels. Then we have MMF again as a second line drug. So MMF की dose कितनी होती है? It is given as per the body surface area. So please remember the dose is around 800 to 1200 milligrams per meter square. ठीक है? Cyclophosphamide का 2 था, cyclosporin का 4 था. ठीक है? Cyclophosphamide was 2 mg per kg per day. Cyclosporin was 4 mg per kg. Tacrolimus is 0.2 mg per kg. And MMF has a dose based on your body surface area, that is 800 to 1200 milligrams per meter square. Again, you can give it with the tapering of the steroid therapy for a prolonged duration of 12 to 24 months. ठीक है, तो जैसे जैसे आप स्टेरॉइड टेपर करते हो वैसे वैसे आप इन ड्रग्स की कवर ऐड कर सकते हो. साइड इफेक्ट्स क्या है एमएमएफ का? वी ऑल नो इट इज जीआई डिस्कम्फर्ट, डायरिया एंड फॉल इन योर टीएलसी काउंट. So you have to keep monitoring the CBC every 1 month at least till you give these therapies to the patient, especially with cyclophosphamide and MMF. It is very important to look for leukopenia. ठीक है, GI discomfort and diarrhea occurs, so TLC monitoring is very important with these patients. Then we have levimazole, which is another second line agent that can be used for nephrotic. Levimazole की भी dose 2 mg per kg है. You have to give it again for 12 to 24 months safely. You can use it. With this also we give the steroid course to the patient. We reduce the steroid dose to a maintenance level and we can stop it. Okay. So that is the same concept. हमें basically aim क्या करना है? जब तक nephrotic का patient complete remission में ना आ जाए आपको steroid maintain रखना है. Once the child goes into the remission phase and you have to stop the steroid so that long acting prolonged duration does not cause any side effect, we shift them to the second line agent. तो जैसे ही आपका alternate day steroid therapy start होता है, you start to taper off the dose and you maintain the dose at the bare minimum possible required for complete remission. And once you reach this level, you have to add the second line agent so that you can maintain the treatment phase of the patient and the child does not go into relapse again. Okay. Now, levimazole की side effects क्या है? L for levimazole, L for leukopenia and flu-like symptoms. ठीक है, two important things that you have to monitor is leukopenia again and flu-like symptoms. Very rare it is that neurogenic or CNS problems can also occur in levimazole. ठीक है, so most important क्या है? Leukopenia. Again, you have to monitor the TLC counts for these patients every 1 monthly. Okay. So these are all the second line drugs that you should be aware, क्योंकि हर बार question आपके steroid पे आता है. You have been asked question on cyclosporin, so it is expected that you can be asked question on any of these drugs. So drugs का नाम, drugs की dose, drugs की duration and side effects. Just 4 basic things. Levimazole 2 mg per kg, 12 to 24 months. Side effects are leukopenia and flu-like symptoms. Duration सबका 12 to 24 months है except cyclophosphamide, which is very very toxic, which you should not use for such a prolonged duration. MMF is given on the basis of your body surface area. So 800 to 1200 mg per meter square, 12 to 24 months. Side effect is your gastric complaints and TLC decrease. Tacrolimus 0.2 mg per kg, 12 to 24 months. Side effects being hyperglycemia. Please remember hyperglycemia. It is used in adolescent age group and you have to monitor the RBS with this. Then we also have the calcineurin inhibitors जिसमें cyclosporin use करते हैं 4 mg per kg 12 to 24 months. Again, you have to look for the side effects of cosmetic problems like gum hypertrophy, hirsutism. There is increased cholesterol, increased renal toxicity and increased liver enzyme problem. So monitor क्या करना है? KFT, LFT and also you have to do a lipid profile. Renal biopsy is indicated, जो हमने renal biopsy के slide में देखा था. Before starting the cyclosporin therapy, you have to do a renal biopsy for the patient. Then we have cyclophosphamide 2 mg per kg per day, but maximum we prefer to use it only for 8 to 12 weeks time. It is highly toxic. It can lead to side effects of hemorrhagic cystitis and gonadal toxicity. Plus leukopenia is very very important. So you again have to monitor the TLC counts, and before starting this therapy you have to give adequate fluid intake or you have to hydrate the patient because it can lead to hemorrhagic cystitis. Okay, so these are the basic drugs that you should know the name, the dose and the side effect and the duration for your exam. Okay, so let's move on to the another very very important topic, that is complications of nephrotic syndrome. So if you get a clinical question, because this year you have got a question, simple question on nephrotic. What is nephrotic? A child presented with this much cholesterol levels, had fat cells in the urine, had generalized anasarca, and the age was also supportive, and there were very simple options and the answer was nephrotic. So it is expected next time you can get another question from nephrotic, which could be the clinical approach, the complications or the treatment. क्योंकि हमेशा क्या होता है, जो explanation होता है उससे next question आता है. So that is a general pattern that happens in all the competitive exam. So please study nephrotic syndrome very much in detail and properly. This is all the detail that you need to know. Apart from this, you won't get any question, I believe, beyond this. So the first slide was very clear, definition of nephrotic, जिस पे question आ चुका है already. So if you read it in detail, you can expect whatever question comes from nephrotic, you can answer it rightly. Okay. So complications basically occurs because of the pathophysiology that we have studied. So regarding the pathophysiology, बहुत सारे कॉम्प्लिकेशंस हो सकते हैं नेफ्रोटिक में बिकॉज देयर इज लॉस ऑफ मेनी काइंड ऑफ प्रोटीन्स इन द बॉडी. ठीक है, तो एल्ब्यूमिन लॉस होने के वजह से हमारी बॉडी में एडिमा हो रहा है दैट वी हैव ऑलरेडी स्टडीड बिकॉज ऑफ प्रोटीनूरिया व्हिच कॉजेस प्रॉब्लम इन योर प्लाज्मा ऑन्कोटिक प्रेशर. ठीक है, दैट इज द अंडरफिल थ्योरी दैट वी हैव स्टडीड. तो इस वजह से पेशेंट को एडिमा होता है. Transferrin can also get lost. So transferrin loss की वजह से the patient can go into anemia. Then what is happening? The TMG is also getting lost, जिसकी वजह से the patient can have features of hypothyroidism. Other proteins, that is vitamin D binding globulins, are lost because of which there can be problems of hypocalcemia. सब कुछ कम हो जाता है बॉडी में. क्यों कम हो रहा है? क्योंकि जो इंपॉर्टेंट प्रोटीन्स है हमारी बॉडी में, जिसके बाइंडिंग की वजह से एंजाइम्स के एक्शंस होते हैं, जिसके बाइंडिंग की वजह से ट्रांसपोर्टेशन होता है, all of them are getting lost due to increased permeability of the capillaries. So because of the basement membrane disturbance, ये सारे प्रोटीन्स हमारे यूरिन में लॉस हो जाते हैं. So whenever there is decrease in these proteins, its effective work in our body or the effective function gets compromised. Albumin कम होने से edema हो जाएगा, transferrin कम होने से anemia हो जाएगा, thyroid globulins के वजह से hypothyroidism हो जाएगी, vitamin D प्रोटीन कम होने के वजह से hypocalcemia हो जाएगा. Very important, immunoglobulins. अगर immunoglobulins की loss हो गई, what will happen? The child will have repeated infections, and it is very much expected upon the infections, the questions to be coming, which is the most common infection, which is the organisms that are important in terms of infection and nephrotic. I'll tell you that in detail in further slides. So immunoglobulin loss की वजह से there can be repeated infections in patients of nephrotic. So this is very very important. Please remember it. Coagulation factors की loss हो सकती है. So this is again a very grave complication, that is there is hypercoagulable state. So hypercoagulability होने से क्या होता है? What is the complication? It can lead to all the CNS complications like stroke. It can lead to all the thrombosis and all the other complications like renal vein thrombosis, cerebral vein thrombosis, hypovolemia, and all of these complications can occur. So these two are star marked complications that you should be very very sure of. Okay, don't go wrong on these. One is your infection and the other is the hypercoagulable state. ये दो infections और hypercoagulable state पे detailed questions आ सकते हैं. Otherwise you just need to know albumin से edema होगा, transferrin loss से anemia, TMG loss से hypothyroidism, vitamin D loss से hypocalcemia, immunoglobulin से infection, coagulation factor के disturbance से hypercoagulable state. ठीक है. Now infections जो होते हैं they can be acute and they can be chronic as well. So infections की slide आगे that I'll tell you in detail what are the common infections that you need to know. Hypercoagulable state I have told you, because of alteration in coagulation factor you can have a lot of problem like renal vein thrombosis can be there can be peripheral vein thrombosis, there can be cerebral vein thrombosis. So thrombotic attacks, stroke, and all of these problems occur because of disturbances in the coagulation. Beyond this, if it is not treated properly with steroid, what can happen? The child will definitely go into renal failure. So if you late diagnose this condition and you don't treat it adequately with steroid, the child can have renal failure, which is a part of the disease process itself. So if any patient of nephrotic anytime goes into acute renal failure, what will happen? AKI again we'll do in detail when we do pediatric emergencies. It's a very important topic. What is the symptoms, what is the presentation, but as of now just basics about AKI. So if acute renal failure has occurred, what will happen? The kidney will have suffer a loss in its structure, that is acute tubular necrosis can lead to AKI. So hypovolemia is there, which can lead to acute tubular necrosis. There is intrarenal edema as well because of the loss of the structure and the loss of proteins, which is leading to the damage to the structure. There can be septicemia, which can again lead to acute tubular necrosis. Why is septicemia happening? Because of risk to infections. Now, whatever drugs that we had read, which could be the causes of nephrotic, they can lead to acute interstitial necrosis. Drugs can also lead to acute tubular necrosis. The complication of hypercoagulable state can lead to thrombosis. And also, if you have crescentric glomerulonephritis, if there's damage in the structure, it can lead to the atypical presentations, which were FSGS, membranous, and your membranoproliferative. So these are the atypical types of nephrotic which occur. which can occur due to crycentric involvement of the glomerulonephritis. So all the drugs, all the infections, all the structural damage, anything which is aggravated and is not treated in time will lead to your acute renal failure. So renal failure is the dead end complication which will occur in a patient of nephrotic. Okay. Apart from this, convulsions can occur because of hypocalcemia क्योंकि vitamin D proteins की भी loss हो रही है. In a case who is untreated, there can be hypertension. So end stage or end organ damage that occurs in cases of hypertension can lead to seizures in the patients. Okay. And apart from this, अगर CNS complication हो गया जैसे cerebral vein thrombosis, it can also lead to seizures in the patient. So this is the slide that I'm talking about. Please memorize it very, very nicely. What are the infections that occur in nephrotic? So it is the most common cause of mortality. If any infection is there in a patient of nephrotic that goes untreated, it can disseminate very easily, leading to septic shock, and the child can go into a grave irreversible shock state and can expire as well. So इसमें आपके जो infections है बस आपको नाम याद रखने. UTI is very common. Obviously, we are dealing with renal system, so urinary tract infection becomes very, very common. Peritonitis is second very, very important infection that occurs in patients of nephrotic. So because there is gross edema, there is fluid retention in the abdomen, it can get infected and can lead to peritonitis. Upper respiratory tract infections and lower respiratory tract infections both are common. I've given you a homework to please learn and tell me why do we need to rule out tuberculosis in patients of nephrotic. So what is the importance of TB in patients of nephrotic? Why do we need to do workup for TB? So this is one infection that occurs in nephrotic, but you have to tell me the answer. Why do we need to rule out tuberculosis, or why we have added the workup of tuberculosis in the investigation plan of nephrotic? There can be cellulitis as a complication. There can be enteric fever, hepatitis, and all the viral infections. But questions expected is UTI, peritonitis, respiratory and tuberculosis. Please remember two respiratory problem, that is TB and acute respiratory infection, peritonitis and UTIs, which are the most common infections that occur. So इन infections के बारे में क्या क्या हमें पता होना चाहिए. Peritonitis क्या होता है? तो fluid हमारे abdomen में retain हो गया, that gets infected. So what will the child do? The child will present with pain abdomen. If you examine, there is going to be tenderness. The child will have distension of the abdomen. And what is the cutoff? NEET PG का classical question, number based question, which you should memorize by heart, is if the fluid tap that you have done has more than 100 leukocytes, if there is more than 100 TLC in the fluid that you have aspirated from the abdomen, you can label that case as infected peritonitis. Okay. So please remember this word. Most common organism पे भी question आते हैं. So what is the most common organism causing peritonitis? It is Streptococcus pneumoniae. So S. pneumoniae is the most common organism that will lead to infection or peritonitis. Star mark questions, please make a note of it. Those who are listening seriously to the class and those who have started to prepare very seriously without wasting any time, please make your own notes out of these important things that I'm telling you, because if you have a collection of all the important points, you won't miss on any question in the exam. Okay. So please try to jot it down, whatever is being taught. If you make your own notes in your own handwriting and you revise it instantly after the class is over, or once I finish the whole nephrology unit on your YT and special class, and also if you're a plus subscriber, you'll get a more detailed version of it. So please subscribe as well, so that I can teach you all the units with equal ease and with equal competency and with equal dedication, and you have your complete pediatrics notebook ready before the exam. ठीक है? So those who are listening seriously, I would request you please notes बनाना शुरू कर दो, because अपने writing में लिखोगे, खुद से समझ के लिखोगे, उसको revise करोगे class के बाद, then nobody can stop you from getting your concepts clear. Okay, so treatment we have to give broad generation antibiotics, third generation cephalosporins for 7 to 10 days. Respiratory, I told you. So respiratory infections when pneumonia occurs, obviously the child will have fever, cough and respiratory distress, and he would listen to crepitations. Again, the organism is Streptococcus pneumoniae, which is the most common. You have to treat with oral antibiotics or IV antibiotics for 7 to 10 days. Cellulitis, the organism we all know, it is Staph aureus that causes cellulitis, which can again occur in nephrotic. You have to treat with a sensitive strain to cloxacillin for 7 to 10 days. Fungal infections are also common, but please remember they present with chest infection in form of fluffy opacities or infiltrates on the chest X-ray. Okay, what are the organisms in fungus? It can be Candida or Aspergillus. You have to treat with topical antifungals like fluconazole for 10 days. If it is an invasive, again you had got a question I think from adult part, that is medicine, regarding the fungal infection. I'm not very sure of that question because it was not from pediatrics. So please remember, जब भी systemic infection होता है, we have to always give amphotericin for 14 to 21 days. But if it is a topical infection, you only need to give fluconazole or you can use nystatin for the treatment. ठीक है, तो ऑर्गेनिज्म पेरिटोनाइटिस का, निमोनिया का बहुत इंपॉर्टेंट है, स्ट्रेप्टोकोकस निमोनिया. For cellulitis, it is Staphylococcus. For fungus, we have Candida and Aspergillus. These are all the infective etiologies which can occur in the patient. Out of these, please remember peritonitis definition and cutoff of more than 100 TLCs per millimeter cube, and the treatment for 7 to 10 days that is advised in all of these infections except systemic fungal infection that demands a treatment for at least 14 to 21 days. Okay. Alright, now coming to other parts of the treatment, very basic points. Dietary advice is very important. You can get a simple question on this. All are true except which is the most correct statement, which is the false statement. So when you advise diet, you have to increase the protein intake. Common sense, क्यों? Albumin कम हो रहा है. हमारे इंडियन अस्पतालों में इतना एल्ब्यूमिन होता नहीं है कि हमारे पेशेंट को एल्ब्यूमिन ट्रांसफ्यूज कर दे. So you have to tell the mother to start increase the protein intake. You can give protein powder, you can give paneer, you can give pulses and everything that is advisable. So please increase the protein intake and calories as well. Now you have to remember the fat cutoff. You don't have to advise more than 30% of the total intake to be increased as fat. Okay, not more than 30% of the total intake should be fat. Saturated fats should be avoided. Salt restriction is not necessary in most of the patients now. Reduction of salt intake is only done in patients who are presenting with persistent edema. So every nephrotic or renal patient को ये नहीं बोलना है कि salt restrict कर दो. It is more important to increase the protein in the diet rather than salt restriction. Okay, so salt can be used only in the time when the patient has got cross edema. At that time, you can advise a salt restriction, but it is not a clear-cut indication in the dietary advice. Okay. Now, for edema, it is very important to treat the edema because it can be an emergency. It can lead to sudden onset respiratory distress and failure as well. So, you need to treat edema aggressively. So, once you treat the patient, you see that the patient has hypovolemia. No, that means the edema is not going to respond towards the hypovolemia. You have to treat the edema. So for treatment, we give furosemide. What is the dose of furosemide? We give it in the form of Lasix injection. It is 1 mg per kg. 1 mg per kg पे आपको furosemide देना है. Now because these are your loop diuretics, you must have read in your pharmacology also, they can lead to loss of potassium. तो हमें क्या करना होता है, पोटेशियम लॉस होने की वजह से दूसरा कॉम्प्लिकेशन ना हो जाए, तो वी हैव टू ऐड अ पोटेशियम स्पेयरिंग डायूरेटिक, दैट इज स्पाइरोलैक्टोन. स्पाइरोलैक्टोन की डोज क्या है? 2 mg per kg per day. ठीक है, पहले Lasix दिया to clear out the fluid and to prevent the loss of potassium. For the same, we add spironolactone to the management of edema. If you see there is no response, that means there is no weight loss and there is no diuresis after 48 hours of treatment. If there is no response to furosemide, then what do? We can give a trial of double dose of furosemide till diuresis has been achieved. If you have increased the dose to 4 mg per kg also and there is no response, then you can try another diuretic, that is your hydrochlorothiazide. This also you must be knowing very well from your pharma classes. Hydrochlorothiazide is tried again at 1 mg per kg per day. Okay. If these also not respond, then you have one option of giving a bolus dose of IV furosemide. Once you give the IV dose or you start the infusion, there should be diuresis. If still diuresis has not occurred, the only option that you have is to give albumin transfusion. Albumin transfusion कितने से देते हैं? 1 gram per kg IV. Slowly we give over 4 to 6 hours with BP monitoring. After this, you can continue with your per day doses of injection furosemide. All right. So management of edema is to be done very nicely because it can lead to your medical emergency of respiratory distress and failure. So once you have examined the patient, there is no onset of hypovolemia. That means there is no fluid deficit in the body because it will lead to diuresis. तो अगर शॉक के पेशेंट में आप किसी को हाइपोवोलीमिया है एंड यू गिव डायूरेसिस, इट कैन कॉम्प्रोमाइज द क्लिनिकल स्टेट. सो पहले हाइपोवोलीमिया रूल आउट कर लेना है. इफ द होल सोल प्रॉब्लम इज बिकॉज ऑफ नेफ्रोटिक थिंग, देन यू विल स्टार्ट फ्यूरोसेमाइड. फर्स्ट डोज इज गिवन एट 1 mg per kg per day, क्योंकि डायूरेसिस कॉज होगा, पोटेशियम की लॉस होगी. टू प्रिवेंट दैट विल एड स्पाइरोलैक्टोन, दैट इज पोटेशियम स्पायरिंग डायूरेटिक. ये हम देते हैं 2 mg per kg per day से. अगर आपका रिस्पॉन्स नहीं आता डायूरेसिस में विद इन 48 आवर्स, यू कैन गिव अ डबल डोज ऑफ फ्यूरोसेमाइड, दैट इज 4 mg per kg per day. इससे भी रिस्पॉन्स नहीं आता, यू कैन ट्राई अनदर diuretic agent, that is hydrochlorothiazide, 1 mg per kg per day. इससे भी response नहीं आता, then we have to give a bolus or the infusion of your furosemide, that is at the dose of 1 mg per kg per dose, or an infusion at the rate of 1 mg per kg per hour. Finally, if all the diuretics fail, you have the option of transfusing albumin directly to increase the plasma oncotic pressure, and so that the patient's whole underfilled hypothesis that we have read is managed well and the edema resolves. Okay. So corticosteroid can also help in the improvement of diuresis part if you have started the treatment well in time. So within 5 to 10 days, you would see that the patient has responded to your steroid therapy and the edema has started to resolve. Okay. So you have to be very sure about this hypovolemia complication. So it can occur in disease relapse also. The symptoms of hypovolemia, as we all know, the patient will go dizzy, will have lethargic, will complain of abdominal pain, and there could be pain in other parts of the body. If you examine, there is signs of fluid deficit. So जब भी हमारे fluid body में fluid कम होता है, what is going to happen? Our BP will fall down, heart rate would increase, the pulses will be feeble, there will be cold extremities, there is going to be slow CFT. So if you find that there is hypovolemia in a patient of nephrotic, what do? We do a rapid infusion of fluid. You have to give normal saline as a bolus dose, 20 ml per kg over 30 minutes. You can repeat the dose of this fluid if hypovolemia is still present. If the patient does not respond to your fluid therapy, that means you again have to go for albumin infusion. So albumin infusion देने से क्या होता है, हमारे बॉडी का प्लाज्मा ऑन्कोटिक प्रेशर इंक्रीज हो जाता है. तो प्लाज्मा ऑन्कोटिक प्रेशर अगर इंक्रीज हो जाएगा, then your complications will get resolved. So you have to be very watchful for hypovolemia. Hypertension is another problem that you can face during your management. It may be present at the onset or may appear late due to steroid toxicity. So because renal damage is one thing that is happening in your nephrotic, so hypertension can occur very easily. So what will you do for hypertension initially? You can advise a low salt diet. You can also add the antihypertensives, that is your ACE inhibitors and ARBs. These are the first line drugs that is used. They also have one benefit, it will reduce your proteinuria. ठीक है, so दोनों तरीके से benefit मिलती है. Your blood pressure is controlled and the proteinuria part is also resolved. So management of hypertension becomes very important in nephrotic syndrome. Okay. Another complication problem that you will face during your treatment is thromboembolism. So this occurs because of hypovolemia also, which is one complication that we have already seen. And this also can occur because of loss of coagulation factors due to loss of all the proteins from the capillaries. So hypercoagulable state is a common thing. So because of these two reasons, you can have complications at thromboembolism. So there can be renal vein thrombosis. If the kidney choke ho gayi, what will happen? The patient will have flank pain, sudden onset of flank pain. There will be hematuria and there can be decreased urine volume. So that suggests the patient might have renal vein thrombosis. दूसरा complication क्या हो सकता है? CNS thrombosis. So अगर sagittal sinus thrombosis हो गया patient को, suddenly there's going to be CNS compromise. क्या होगा? The child will go into altered sensorium, can have any neurological deficits like hemiparesis, can have convulsions, raised ICP, right? Apart from this, the child can have femoral vein thrombosis, anywhere the thrombosis can occur, pulmonary embolism, mesenteric vein thrombosis. तो जहाँ भी thrombosis होगा, वहाँ की pulses compromise हो जाएंगी and the child can develop pain in the affected parts. Diagnosis में हमें Doppler करके prove करना है. If not, you have to immediately treat the thrombosis part. Okay. तो हमने सब कुछ पढ़ लिया डेफिनेशन पढ़ लिया, क्लासिफिकेशन पढ़ ली, इमेजेस देख लिए, we have done the clinical approach, we have done the treatment part, we have seen the complications. Now very few recent updates. Recent updates क्या होते हैं? जैसे एक स्टूडेंट ने पूछा कि मैम एग्जाम में क्वेश्चंस थोड़े इजी आ गए थे, so I feel very bad that I studied too much. So it's a good news that the paper was very basic, so you should be happy कि सबका selection हो जाएगा, those who had a basic preparation and those who had an extra level preparation also. So that is a good thing. There's no need to be worried about it. So it should be happy thing for you that there were few questions still which I feel जो मैं अपने special class में discuss करूँगी. There were 14 questions that I've recollected from the recall basis of pediatrics asked in your NEET PG 2021 exam. So you can attend the class on Wednesday, that is day after tomorrow at 5 p.m. You can use my code Kavita S10 to unlock the class and listen it free. Okay, so we are going to have a detailed analysis of the topics and also what is expected now to be asked in the next year's exam, and little bit of theory about whatever topics that has been asked. There are 3 questions जिसके ऊपर अभी भी confusion चल रहा है and people are still fighting and arguing कि ये आंसर सही है, ये आंसर सही है. According to me, what I feel is the right answer with evidence and theory, I will tell and discuss that. So please come and attend this session. So बिकॉज पीपल हैव दिस काइंड ऑफ मिक्स्ड इमोशन कि चलो इतना सारा बैच था इस साल एग्जाम देने के लिए, तो ऐसे हो जाता है कि हमने जो टॉपिक्स पढ़े उन टॉपिक्स में से क्वेश्चन आ गए, बट बहुत ही सिंपल क्वेश्चंस थे. बट देर आर क्वेश्चंस द एग्जामिनर ऑलवेज मेक्स अ बैलेंस्ड पेपर. दैट मीन्स देर आर 2 टाइप्स ऑफ स्टूडेंट्स. वन हु इज वर्थ क्वालिफाइंग, मतलब यू गेट अ रैंक बिकॉज यू हैव स्टडीड द टॉपिक्स एंड यू हैव marked the right answer. But there is a certain bunch of students who study a little extra to get hold of a very good rank. So your hard work always pays. So examiner हमेशा एक balanced paper बनाता है so that there are certain questions which only concept based learning can clear it. तो कुछ एक्स्ट्रा क्वेश्चंस होते हैं जो आपके मेहनत से सॉल्व हो जाते हैं. सो देर आर सर्टेन क्वेश्चंस व्हिच आई ऑलवेज ऐड और सर्टेन एक्स्ट्रा इन्फॉर्मेशन दैट आई ऐड इन माय स्लाइड्स so that if the examiner extends the periphery or the limit of asking and framing the question, at least my topics get within that periphery and you don't miss on it. So I try to put extra in my slides so that जिन लोगों को थोड़ा hard work और करना है, you can read these things, and luckily if you become a pediatrician your course is also half finished and you learn these topics very nicely. Okay, so one thing that I would like to include in nephrotic chapter is the side effect of steroids. ठीक है, बहुत ही important topic है. You can be asked in any subject. मेडिसिन में भी इम्पॉर्टेंट है, पेडियाट्रिक्स के लिए भी इम्पॉर्टेंट है. तो स्टेरॉइड थेरेपी जो हमने पढ़ा था, स्टेरॉइड डिपेंडेंट में प्रोलॉन्ग स्टेरॉइड देने से देयर कैन बी सर्टेन टॉक्सिसिटी, जिसको प्रिवेंट करने के लिए हम सेकेंड लाइन ड्रग्स ऐड कर रहे थे. ठीक है, so why were we adding the second line drugs? Because we want to prevent the steroid toxicity. क्या क्या होता है ना, स्टेरॉइड ज्यादा देने से प्लीज डोंट थिंक दैट मसल मास इंक्रीज हो रही है तो हाइट भी इंक्रीज हो जाएगी. ऐसा नहीं होता. द हाइट बिकम्स स्टंटेड. ठीक है, so the height is going to become stunted because of the growth. ये क्यों होती है? Because there is premature closure of your epiphysis. ठीक है, premature bone closure and fusion के वजह से there is stunted growth. So steroid के वजह से stunted growth occurs. Cataract, we all are well aware of it, that posterior cataracts occur because of steroid therapy. Okay, now steroid therapy is very well known to lead to increased ICP, that is your intracranial pressure, that occurs because of a condition known as pseudotumor cerebri. So this mimics like a pseudotumor. It is going to present with features of increased ICP, but it is actually not a tumor. Okay, so that is very clear. Pseudotumor cerebri occurs as a steroid toxicity. Psychosis can also occur as a CNS complication. The bones become weak. We all know steroid में हमें Z score करना होता है, DEXA scan करना होता है. क्यों करना होता है? क्योंकि bones में osteoporosis हो जाती है. Excessive steroid can lead to cushingoid features. So your buffalo hump, increased fat deposition on the abdomen, the typical facies, thin extremities, all these are cushingoid features that develop in the body. Complications जो होते हैं, adrenal gland suppression हो जाती है. So again, your hormonal disturbances start if you give excess of steroid in any treatment. It causes hyperglycemia as well. So your RBS disturbance is there. It can lead to myopathy, that is your skeletal muscle weaknesses can start. Stomach में it can cause peptic ulceration. Steroid देने से poor wound healing होती है. Those patients who are on prolonged steroid therapy, if they get a wound, there is poor healing. Steroid therapy से there is cosmetic problems, that is hirsutism. and it is itself a risk factor for developing thromboembolism. So you can be asked this question in any form, in your adult medicine form, it can be asked in pediatrics, it can be asked from pharmacology. So please memorize the side effects. I'm sure most of the educators must have taught you from different subjects, but these are all the classical side effects of steroid that can occur, which you should be very clear about. Okay. Now, for those who want to learn a little extra and want to score a little extra, if by chance these questions come, so we have recent updates on what is the immunization problems in patients of nephrotic. So very basic things I'll tell you from here. So immunization basically is very important in patients of nephrotic. क्या क्या वैक्सीन्स में क्या क्या प्रॉब्लम होते हैं. So this is extra topic. I'll mark it because अब students इतने frank हो गए, the learners are themselves telling that थोड़ा सा extra पढ़ने से अच्छा नहीं लगता अगर बेसिक क्वेश्चंस आ जाते हैं, बट अगर एक्स्ट्रा पढ़ के जाओगे देयर आर डेफिनेटली 4-5 क्वेश्चंस in the paper, maybe 1 or 2 questions from each subject, which is definitely the extra edge. तो अगर एक्स्ट्रा पढ़ के जाओगे, एक्स्ट्रा क्वेश्चंस मार्क करके आओगे, so that gives you a boost of your rank over other competitors. ठीक है. So this is an extra topic. Those who can manage to study it, please read it. जिसे बेसिक प्रिपरेशन ही अभी प्रिपेयर करना है, later on you can read it, so it's not a problem, but I'll tell you what are the extra important updates which can be asked as a recent update in the exam. This is an extra topic. ठीक है. तो हेपेटाइटिस बी, योर MMR एंड मेनिंगोकॉकल वैक्सीन, अगर ये हम देते हैं पेशेंट्स को, जनरली इट हैज बीन रिपोर्टेड फ्रॉम आर्टिकल्स दैट आई एम टेलिंग यू. आर्टिकल्स मतलब जो एक्चुअल स्टडीज होती है हमारी कंट्रीज में, दैट दीज वैक्सीनेशन कैन प्रेसिपिटेट अ रिलैप्स. रिलैप्स क्या था? ट्रीटमेंट के दौरान if the patient again goes into that definition of nephrotic, so that is a relapse. So hep B vaccine, MMR and meningococcal can cause a relapse. ठीक है. Now patients who have receiving or are on the dose of 2 mg per kg per day for a duration of more than 14 days, they should be considered immunocompromised. So जो immunization का lecture मैंने लिया था, जहाँ जहाँ मैंने बोला active immunocompromised में वो contraindicated, you cannot give a live vaccine, इसका मतलब ये भी है कि जो patients आपके full dose steroid therapy पे चल रहे हैं for more than 14 days, you will consider them also as immunocompromised. ठीक है. तो इन पेशेंट्स में लाइव एटेन्यूएटेड वैक्सीन उस टाइम पे नहीं देना होता. ठीक है. नेक्स्ट थिंग, लाइव वैक्सीन्स वंस अ चाइल्ड इज ऑफ इम्यूनोसप्रेशन मेडिकेशंस फॉर एटलीस्ट 4 वीक्स. कब दोगे? जब आपने स्टेरॉइड थेरेपी बंद कर दिया है, आफ्टर 4 वीक्स यू कैन गिव लाइव एटेन्यूएटेड वैक्सीन इन पेशेंट्स हु वर ट्रीटेड फॉर नेफ्रोटिक. ठीक है. सो 14 डेज तक जो फुल डोज स्टेरॉइड पे है उनको इम्यूनोकॉम्प्रोमाइज्ड के तरह कंसिडर करते हैं. Once they are off the steroid therapy for 4 weeks, then you can treat them or give them the live attenuated vaccines. If there is a very much need to give a live vaccine, that means there's a pandemic or maybe the child is going to some other country or any reason for which you have to vaccinate to the patients, then you can give them if they are on alternate day steroid therapy for a dose less than 0.5 mg per kg. तो इस स्लाइड से अगर कुछ याद रखना है तो प्लीज रिमेंबर हेप बी, MMR and meningococcal vaccine can precipitate a relapse in patients treated for nephrotic. Once the child is on full dose steroid therapy for that 2 mg per kg per day duration, will consider the child as immunocompromised. इस ड्यूरेशन में अगर 14 डेज तक वो फुल डोज ले चुका है, आपको लाइव एटेन्यूएटेड वैक्सीन नहीं लगाना. अगर लगाना है तो कब लगाना है? Once the child is off steroid for at least 4 weeks. You can also give an alternate day prednisolone therapy. During this phase, you can give a live vaccine if it is very much needed. This is a very rare situation, so just remember that 4 weeks of steroid, you can give the live vaccine. Now, pneumococcal vaccine, it's very important that we have got 2 to 4 doses of the pneumococcal vaccine for the children who are young, that is less than 2 years of age. So, for those who have been previously unimmunized, that means primary dose nahi mili hai, then a priming dose of the conjugate vaccine you can give 8 weeks later, the first dose of 23 valent polysaccharide vaccine. The pneumococcal vaccine may be jo conjugate vaccine hai, that can be given if a child is completely unimmunized with the primary dose. So a priming dose can be given, then 8 weeks later you can give the dose of the polysaccharide vaccine. So it is not absolutely contraindicated. So जो contraindicated बिल्कुल है, that is hep B, MMR and meningococcal. So polysaccharide vaccines also we can give, but you should be always sure that the priming dose with conjugate vaccine has been done. Okay. Now reactivation after 5 years is considered for children with active nephrotic syndrome. Okay, sorry, revaccination that can be considered those who have the active nephrotic syndrome. So in these children, you might require the vaccination. Regarding varicella, a single dose can be given at 12 months. Any dose can be given during this duration, but two doses separated by an interval of at least 4 weeks should be used. So varicella is also now not contraindicated in nephrotic. You can give it easily. Now varicella infection is very, very important for your nephrotic syndrome. Now, patients who are susceptible patients, that means those who are unimmunized or those who have had a history of varicella or got exposed to a case, in those patients, acquiring a varicella infection is highly risky. मतलब it can occur. So, in these patients, जो nephrotic syndrome के patients है या treatment पे चल रहे हैं, if they accidentally get exposed to varicella, you have to give a single dose of varicella immunoglobulins within 96 hours of exposure. So if any patient gets exposed to varicella, you have to treat them with immunoglobulin. Please remember, it's very, very important. Alternatively, you can give an IVIG dose also, means you have to give immunoglobulins to the patient. You can also give them acyclovir, either IV or oral doses for 7 days for the treatment. So varicella infection can be acquired very easily in patients who are of nephrotic syndrome or getting treated. So you need to cover the patient with immunoglobulins and also with the treatment of acyclovir. Okay. Regarding TB, so as I was telling you, this was your homework, but still, chalo bata deti hu. Now, patients with nephrotic syndrome, it's very important to rule out tuberculosis because if you start the steroid therapy, it can lead to dissemination of the foci of TB. So that is why in the investigation with CBC, पहले इन्वेस्टिगेशन के ही बाद टीबी वर्क का बहुत इंपॉर्टेंट हो जाता है because you have to rule out that the patient does not have any hidden foci for tuberculosis. So patients with nephrotic syndrome will become Montaux positive, but there is no evidence of active TB. That means has been exposed to tuberculosis bacilli sometimes in the past. You can give INH prophylaxis in this patient for 6 months. Those who have active tuberculosis on your workup, that means unko TB hai already, then definitely first you have to start with the standard doses of ATT regimen. Okay, so that is why it's very important to rule out TB before starting your steroid therapy. So these were the extra updates which I feel from my side can be asked in some way or the other in any of your upcoming exams. So extra updates पढ़ना भी important होता है. So thank you all of you. This was all about nephrotic and honestly nothing beyond this could be asked. So if you have studied nephrotic today in this whole lecture of 2 hours, please go and make notes of it. Please jot down the important points and revise from this only again and again and again till your exam, till the time you're doing the pediatric nephrology. So now we have very small topics to read in nephrology. That is your urinary tract infections are different, that I'll tell you differently. We have to do nephritic, we have to do all the glomerulonephritis, the approach to HUS, the approach to HSP also. We have to discuss about the little bit of development of the kidney also. So all of these will be taken up in small parts in the further lectures. And also, since I have to take the classes on special also, those who are following religiously the nephrotic chapter or the renal chapter, please come and join me on the special class also for the nephrotic. So these special classes will occur mostly on Wednesdays. I'll announce you the date very soon. So this Wednesday we have two special classes for which you can use my code to unlock it and listen it free. That is Kavita S10. If you put down this code, you can unlock the special class and you can listen it free of cost. We have two special classes this Wednesday. One is at 5 p.m. That is your recall discussion of the NEET PG questions 2021. And following this, after we finish it off around 7 p.m., we'll have a class on renal. That is your nephro part. So whatever topics are being taught on YouTube, the continuum of this would be taught on the special class. So please maintain that continuity and don't break it because I'll try to cover anything and everything from nephrology unit. It's a very beautiful unit and highly concept based also. Simple unit and very, very scoring. बहुत simple questions आते हैं nephrotic से. The whole renal system. So very simple things we have to study. So those who are listening to the YT classes, this was the first detailed class that I've taken on nephrotic part. So apart from this, all the small topics that we have to read, that also will be covered. Multiple topics would be done in a single session because this was the most hectic topic, which is the most focus of the examiner. इसलिए मैंने इतने डिटेल में पढ़ाया है क्योंकि अगर कभी ऑल्टर्ड क्वेश्चन आता है तो मोस्ट लाइकली नेफ्रोटिक से ही आएगा. So those who are listening to the live class and those who would listen to the recorded version, I request you to please maintain this continuity of attending the classes. Once you do the YT classes that I took yesterday, today, and tomorrow, please come and attend the special class as well. You can use the code that is going to be free for you, so you can attend the class for free. Take the trial of the classes, and if you like the way of teaching and if you feel that these units will be covered to the level that you need for your preparation of the upcoming exam, especially NEET PG exam, then please come and subscribe for the plus hours also. So under plus hours this month I'm finishing cardiology and I'm finishing respiratory pediatrics. So because I specialize in pulmonology also, I'm very interested to teach this. So I think all of you, those who want to learn it from me, please come and join for the plus sessions also, so that you can be a part of that dedicated teaching. So this is the update for NEET PG 2021 recall question session is on 15 September, that is day after tomorrow and Wednesday at 5 p.m. Please use my code to unlock the class for free. Okay, you can put down this code. जहाँ भी आपको code use करना है, you can just put down this code. It is Kavita S10. Once you put down this code, you can access all the special classes that I am taking free of the cost. You can just use the code to unlock the class while you download the Unacademy app, and you can listen to all the classes that I'm taking. Mostly I'll be covering the systemic pediatrics, which is most important and most bulky part in pediatrics. So whatever systems I'm taking, I'll take it in continuity. So if you want to stick on to the teaching, please keep unlocking the code and attending all the special classes. And those who have not downloaded the Telegram channel, please come and download Telegram first and follow us on Let's Crack NEET PG channel. If you follow this, you get all the updates of the important classes that we are taking. You also get all the links to the important lectures. So you'll be staying updated about all the important classes that is there. And whenever you do a reference, that means you take your plus hours or the iconic hours, please use my code Kavita S10. You put down this code at the time of payment, you get a magical discount of 10%, and also you become a member of our team so that we can give you a very dedicated learning. So please like, share, and subscribe the YouTube channel also, so that you can get all the updates and you stay connected with us. So one important slide that I had mentioned right in the beginning. So for all of you, again to remind you, we have this limited time offer for all you guys. जिन लोगों को अब प्रिपरेशन स्टार्ट करनी है, जो अब नेक्स्ट ईयर का नीट पीजी टारगेट कर रहे हैं, that is 2022, please come and subscribe with this important subscription that we have as an offer for all of you. So those who want to take the subscription, it is a limited subscription that we have only for the first 500 students. So this 500 students के लिए subscription valid है. So we are getting all the subscriptions very fast, and all of you, those who are interested to take, please make up your mind as soon as possible. It is a limited time offer. The best subscription that we have, जो combo subscription है हमारा, जहाँ आपके पास Unacademy और Prep Ladder दोनों का complete access होता है in terms of notes, in terms of test series, in terms of video classes, in terms of question banks, in terms of rapid revision series during the end of your exam. तो ये सारा कुछ एक ही सब्सक्रिप्शन के अंदर accommodated है. So you can please come and take this subscription. Use my code Kavita S10, which is very simple. When you put down this code, you get 10% discount more, which is above the discounts that we have mentioned over here. So why we have put it separately? Because this is a limited period offer and the prices have gone down, so that we can take most of the subscribers who want to attend our classes and you want to be a part of the plus hours as well. So if you take it for 12 months, initially you had to pay 45,000. Now you only have to pay 30,150. For 18 months, less than from 50,000, we have it only at 38,250. If you take it for 24 months, not to pay 55,000, it's only 42,750. For 36 months, instead of 65,000, we have 51,750. And for 48 months, the huge amount of 75 has been cut short to 60,750. So depending on the level at which you are right now, if you are targeting next year's exam, take 1 year subscription. If you're targeting the next year's exam, you can take 18 to 24 month subscription. But this is going to be the best that you can get, because Unacademy is the most leading platform for the online teaching of NEET PG. So you can easily trust the educators and you can join our team so that you prepare very nicely for the exam. So I expect to see many students this month in the plus hours also. And from pediatrics, I would be covering cardiology complete and the complete respiratory unit on the plus hours. So please come and subscribe as soon as possible so that you don't miss any of the classes. Please use my code Kavita S10. The first 500 candidates who use this will get this instant discount, which is above the discounts that we were offering earlier. Okay, so all the best to all of you. Thank you for being so patient. Thank you for sharing your responses for the NEET PG exam. And soon we are going to meet up tomorrow again with other important topics of nephrology. So those who are listening in continuity, please revise nephrotic syndrome. If you want to feel more confident about nephrotic syndrome, please open up your MCQ books and just solve the MCQs after reading my notes. If you have any doubts, which I feel you would not be having, but still if you have any doubts, you can ask me in the next session. So anytime you have doubts, you can post in the chat box. I'll definitely clear it to the best of my extent. So thank you for being so patient.